Yes, my brothers and sisters. You have pen and paper. Pen and paper you have. You can write a model. MODEL, model. You write in model. Right? Now answer simple question. Who is your role model? Your role model. Role model. Who is your model? Role model. Yes. For us, for you. Yes. Yes, sir. Who is your role model? Okay. So I got the question to you. Who is your role model? I wrote answer here. Just read it. Your father, your mother, Prophet Muhammad and teacher. Your answer is here. Yes, sir. Your answer is here. Anyone out of this box? Anyone has model and teacher? Anyone, right? Teacher. Out of family, father, mother, they play important role. Therefore, I see them. Other than family, for religious purposes, people follow Hazrat Prophet Muhammad. But other than the family members, so teachers, students follow teachers as a role model. So the professors, the word professors came from the word professor. Okay. So in Japan, the professor means next to God. Next to God. Yeah, professor means professor. Professor, if professor said something, must be done. Anyway, model, that means you like someone, if your model is for a teacher or father, mother. But mostly, normally we our role model is someone, but we follow someone. Okay. So let's talk regarding this, my first topics, today's workshop, development of animal models for drug research. Yesterday, we discussed the discovery and development of drug. Right? Discovery and development for drug. So drug discovery and development, a lengthy process, risky process, lead many peoples from chemistry background, biochemistry, biology, microbiology, pharmacy, and statistics. So it's long time. So from traditional method as well as biotechnological method, either it is pharmaceuticals or from biopharmaceuticals. You need a simple or single molecule, lead molecule, okay? Molecule to market, right? Or for biopharmaceuticals, so you need biotechnology. For the, you are working on veins, you are working on laboratory from veins to bedside, okay? Daily use. So in this process, you will have to do some experiment in laboratory, some experiment in the hospital. In between, some do before going to hospital, you have to do some preclinical research. It's all this clinical research is done in animal. Okay. So as I told you, so this is the drug discovery procedure. Okay. So the drug discovery procedure. Okay. drug discovery and development, this preclinical, this clinical, then FDA. So in before this preclinical, so this stage preclinical test is done in vivo using animal model. So before the clinical studies, we are using the preclinical studies. All the preclinical studies done in animal. Okay. So what is animal model? An animal model is a living organism in which normative biology or behavior can be studied, or a spontaneous or induced physiological process. Normally, we can do our experiment in normal rat, normal mice, normal animal, right? It is the control cases. But in some cases, we have to make disease model. In disease model, in the animal, we can do some induce, or sometimes it's some spontaneous model. Okay. And if it is a spontaneous model, it is physiological. But it is induced, it is may physiological or may not. May or may not. So animal model, the pillar of discovery and development of essential medicines for the betterment of human health and condition. Animal models have served previously and currently as the vital research tool in taking promising therapeutics from early phases of preclinical studies to later clinical phases, trials with humans. So we are doing this kind of test in animal model to give some idea, some predict something. We can predict business. Okay, and normally once the drug is developed, you take it before going to market. You have to do some pharmacokinetics and pharmacodynamics. This kind of study normally we do in animal. The clinical models can add great value upon knowledge of medicine and biology, and the discovery and development of new drugs, provided such studies are conducted appropriately with decisions. So how important the animal model, right? How necessary of animal model for modern drug discovery? No alternative. No alternative for the traditional medicine. So now see the model, the things, animals models, right? One is animal, another is laboratory animal. Model. So what is animal? Can anyone tell me what is animal?
Generally, जो भी animals living animals.
Okay. Human is animal or not?
Correct.
Yes, no?
Yes.
Are you sure?
Which is science.
Once upon a time, once we are somewhere, now we're in home. That means it takes many hundred and thousands years. Now we're a human. Sometimes we are outside, at that time we are in some kind of animal. Okay, the birds, tigers, this living there, we are also living same places. Some matter of time, matter of process, we civilized, we urbanized, we policed. Initially, you got my point. Okay. So now my question is, what is the difference between animal and animal model or laboratory animal? Animal and laboratory animal. Can anyone tell me?
These are tamed. Different on say,
it has certain characteristics which are not which are developed intentionally for the.
So this kind of animal, laboratory animal, it's come from normal animal, from asman, from the
Not
sky.
from normal animal, but it is sometimes it's a special breed, or sometimes it's like developed. It is having some characters which are intentionally developed or which we imported in to certain.
Okay, you're right. You're right. Look, animal and laboratory animal. Big difference is animal is dangerous. Either it is mice or rat. Laboratory animal 100% safe. Even it bites, it is poisonless. I'm giving an example, right? Tiger is dangerous or not dangerous? Very dangerous. if you take a tiger at your home, right? So little by little time, okay, he's still dangerous. He is in cages, right? Then after 1 or 2 or 3 or 4 years, उसका 2 baby आएगा, 2 or 4, right? So they are less dangerous. Okay, you give life, love and affection. Then the first generation, उसका the second generation आएगा ना. So this tiger will not put in cage, will put at your home, or they can sleep with you. Yes, you can take उसका baby जो है ना, you can take with you. I'm giving the example that initially tiger was dangerous, harmful. So after first generation, second generation, third generation, it is, don't know. He is accomplished, he's very familiar with your house. Okay. So how many people here from Karachi, from Islamabad? All are from Islamabad?
Yeah.
Okay. So remember this thing. So if someone came in Islamabad and doing job there, and sometimes later you are unmarried, you got married, and your son admitted anywhere, okay, then your son, his hometown is Islamabad, your hometown is somewhere. Then during Eid time or during summer vacation or winter vacation, you are going to your hometown, right? You took your son, जो तुम्हारे दादा का वाली है, grandfather का, उसका जो फिर तुम्हारा जो बेटा, your son, उसका भी son है ना, his hometown is Islamabad. He will not go to your hometown. उसका hometown नहीं है. Okay, different first generation, second generation, third generation, okay, fourth generation, fifth generation. Some of all of you, your father or your father came from somewhere. This is hometown. But now you just heard, okay, I heard my grandfather's home is there. You never ever heard it. But this is your hometown. This is your home. You are more familiar with your, this is hometown now. This is your home. Same is true. The animal is captured from wild animal, right? Wild animal. Keep this animal in good health, good environment, a good shelter, good food. Everything is controlled in controlled environment, right? Then with passage of time, okay, they give the first generation. Okay, first generation. Then second generation, third generation, fourth generation, fifth generation, sixth generation, seventh generation, eighth generation, ninth generation, 10th generation. After certain some 10 to 12 generation, the animal is called laboratory animal. In the meantime, he got all the characteristics, all the bad habit. Okay, now all the bad habit, all the gone from his physiological part. Now this animal is no more dangerous. It is safe. If it is bite, it has no poison. So this is the big difference from the animals and laboratory animals. Yes, my brothers and sisters, if you want, okay, normally mice and rat, people very much afraid, right? If we got some mice and rat at your home, first thing, what do we do? मारो उसको, ठीक है ना? In laboratory animal, if you see it somewhere, what will you do? Save it somehow. What is rat or mice? It depends on your degree, depends on in his life. वो मर गया तो तुम्हारे PhD मर गया. Okay, you know, डरना मत. So laboratory animal is safe, no poisonous. So give them love and affection. It will be very friendly, very friendly. Okay. So if especially those are female, okay, I found that very much afraid of mice and rat. No, वो तो बच्चे हैं. Make them a child. If you give more love, more affection, empathy, sympathy, you'll get good results. Okay. So now you got clear idea what is animal and what is laboratory animal. How the laboratory animal is developed. Okay. And model and animal model, right? So in human life, as I told you, so who is your model? So someone write my father, someone write my mother, someone write Prophet Muhammad Sallallahu Alaihi Wasallam, someone write teachers. Normally, you want to follow him or her, what he's doing, what his lifestyle, what his way of taking, many things. Same is true. Normally, it depends on your experiment, depends on your research. What kind of research you are doing? According to, you have to follow this model. If you want to be a cricketer, you have to follow a model of cricket legend. If you want to be a, you can do in on movie, cinema, drama, then it's better to follow a model from drama, not from cricket. Okay, select or choose the right model for your life or right model for your experiment. Now, so animal used in research all over the world. There is two things. One is mice, another is rat. All over your life, okay, 90% in your life, you will take chow or roti. Only few percent you will take other things regarding carbohydrate. Same is true all over the world. The research animal mostly on two species. One is mice, another is rat. More than 95%. The remaining one is the guinea pig, rabbit, hamster, cats, dogs, others. This is even 5 to 10%. So these animals we divide into, this is the mammals for research. So
What
these,
is the, sorry, what is the example of others? Is there any example? of
Yes.
others?
goat, donkey, these are also examples.
What about C. elegans?
This is biological example by C. elegans, zebrafish.
Yeah, we use
Huh.
that in.
Yes. Now zebrafish also good model. Now zebrafish replaces.
So, is there any like constraint on using like big animals? Are these like vicious animals? Then if you can use C. elegans, normally West doesn't allow you to use other animals.
So the C. elegans, normally C. elegans, the C. elegans you cannot use normally it is a transparent. Okay, anyways. So no, for your study, if it is your drug discovery process, no, it is developmental. If you want to some developmental process, so you can see this one. But drug discovery, you cannot do this illegal. So every model has some limitation. For drug discovery, or develop for basic science, or those are working on developmental process. Okay, you can do this kind of work on C. elegans. This drug discovery can't do that.
And how much extent this cell lines have replaced these animals?
No. Cell line is in vitro. Cell line and animal is 100 completely different. There is no comparison. There is maybe, but cell line is cell line. Living condition and non-living condition is okay. So what is this one? PE. What is this one? Pain, right? Pain, and this is pain and hen. Completely different. Hen and men, different or no different? No different, living things. Okay, living things. Men, before married, you are tiger. After married, you will be. So, this animal model, so rodent model, sometimes in all the mammals, we divide two things. One is rodent, another is non-rodent. So, rodents are rat, mice, guinea pig, hamster. These are rodents. And these are non-rodents, rabbit, monkey, cat, dog. transgenic animals. These are the non-rodents. So why it is called rodent? Because they have very sharp teeth. Okay, the rat can eat everything. Your books, notebooks, even they can eat table and chair because they have very sharp teeth. Okay, narrow edges, tooth with front in mouth, adapted from cutting. They can cut everything. Okay, therefore they called rodent. So now see, this is the animal model. One is mice, another is the rat. So what is the advantage and what is the disadvantage? So mice, the advantage is it's a small animal. Okay, it takes normally to maintain it, it takes less space, it takes less food. Okay, it makes economical for the lab. Okay, it's budgetary. Small, easy to handle, inexpensive, wide range of reagent and availability. Many can do things in the mice. A disadvantage की है? Sequential blood sample from sample of animal is difficult. Many things can do for the, if you want to draw blood from mice, 0 minute, 0 minute, 0 minute, 15 minute, 30 minute, 60 minute, 120 minute. These 5 times, if you want to draw blood from mice, it is almost impossible. Okay. So this is possible in rat. Now what is the advantage of rats? Similar to mice, but comparatively larger in size. Comparatively larger in size. One mice, can you tell me what is the weight of an egg?
30-35 grams.
Egg, anda.
Exactly.
No, no. More than that. Is egg is heavier, chicken egg is anda. Egg is heavier or mice is heavier?
Mice normally weighing around 30-35 grams. Average we are going to use.
Okay, I agree.
Egg
Okay.
is heavier.
So egg is 3 times heavier. A normal one egg is 100 gram. Okay. One egg.
We don't find though that where. Really, it is hard to find.
Where?
Everywhere we go, they are giving us small eggs.
Okay.
Standard weight.
Okay.
defined
Okay.
is 60
Please.
grams.
Okay. Now give me one question. Okay. Cow gives milk, right? Chicken give egg, right? Can you tell me which animal give both animal milk and egg? Cow give milk, right? Chicken give egg, right? Which animal give milk and egg both? Huh? No. Dukandar. Right. Then you have to choose a good dukandar. Okay. Okay. So animal mice is 30 to 35 gram. Okay. Easy to handle. In one cases, you can take more than 10. So in small cases or small spaces, you can adapt more than 10 mice. Right? Rat is 200 gram. 330 and 200, almost 10 times higher. In a case, you can adapt from 4 to 5. Okay, the experiment you can do in mice, similar experiment you can do in rat. Only the weight difference is weight. Okay, size matters. Sometimes most of the experiment done in the mice. If it is not needed, some spontaneous blood collection. Okay, so why it is mice? Because for drug discovery, you have to give some pure compound to the animal. So in this animal, we have to give kilogram per kg body weight. So if you test any compound, either mice or rat, that means 30 gram, let's say for sepside in rat, not say 200 gram, almost 10 times higher. That means a single dose needed 10 times more compound. Okay, therefore, for this experiment, mouse is very important and mouse feasible, economical, less expensive.
That is expensive as well.
That is expensive. It takes normally this body weight. Normally, in animal experiment is animal laboratory animal is very expensive because everybody have to give good food, and animal food is more expensive. Animal food is expensive. Okay, because you have to provide the food. Okay. Maintaining the laboratory animal is expensive. So this experimental use, normally we do toxicological study, bioassay, screening of chemotherapy, studies related to genetic and cancer research, drug action on CNS. This is the some, but many we can do in animal experimentation. So why we are doing animal models? This animal model can support and develop medical product development during non-clinical phases. This animal model can address the regulatory safety. For the regulatory safety, you must, there is a guideline. Okay, how many animals you have to use it? For mice and for rat, you have to take more, there is a specific number is there. You have to use more than 10 and 12 in case of rat. In case of mice, number is constant. You have to take same number of male and female. Everybody, for this one, you have to follow this one. For safe side, there is mortality rate. For safe side, we take more animal. Animal studies can provide insight, value of preparation of the regulatory submission. Without animal experimentation, we cannot do regulatory submission the report. Okay. The animal model used in biological functional studies. One is sit here, animal model used in disease research. Okay. Induced or experimental, spontaneous and transgenic. So once for toxicity test, we do toxicity in the control rat or control mice. For toxicity studies, okay, for toxicity studies, so what we do, we check either the chemical or my lead compound, my drug candidate, it is safe or not safe. We do toxicity test. For toxicity test, what we do here, okay, so 1, 2, 5, 10. So this at least we have to check three at least we have to check 3 doses. Say 1, 2, 5, 10 milligram per kg body weight, right? We have to give 1 kilogram, 1 milligram per kg body weight, 2 milligram, 5 milligram, 10 milligram, and we checked single dose, either the animal is alive or not alive. Okay, then we can check the lethal dose, mortality rate, many things. My question is, so you have to do 1 milligram per kg, 2 milligram per kg, 5 milligram per kg, 10 milligram per kg. Okay, 4 different doses. But for the experiment, what is the tips and tricks? What you'll do? You will do this. Say I will say 1, 2, 5. These 3 doses. Okay, 1 milligram, 2 milligram, 5 milligram per kg doses, per kg body weight. In your experiment, what you'll do? So each group you have 5 animal, 5, 5, 5, 5, 5, 5. Then you'll do, what will you do? Anyone can tell me? So you want to test the toxicity of a drug, right? So you have 3 doses. One is 1 milligram per kg, one is 2 milligram per kg, and there is 5 milligram per kg. So during the real experiment, what you will do?
We can do it through blood compatibility test.
वो तो बाद में आएगा ना. So
उसको measure करेंगे कितने वेट है उसका, उनको कितने मिलीग्राम हमें देनी है पर केजी बॉडी वेट के साथ.
ठीक है.
उसके बाद वो उनको जो ग्रुप्स हैं उनमें इंजेक्ट कर देंगे, एक को कंट्रोल रखेंगे, छठे को और 5 को हमको इंजेक्ट कर देंगे और उनको 24 आवर्स के लिए ऑब्जर्व करेंगे.
He is absolutely right, but it is traditional system. But smart thinking is, so if first we will do the highest dose, 5 है ना? 5. Okay, we'll focus on 5. If animal is, there is no mortality in 5, you can save animal, you save more time. You got my point. The maximum dose we are thinking, the maximum dose, give the first maximum dose. If maximum dose is safe, that means lower dose is the more safer. Okay, you arbitrarily have to think it and first check only one doses. Next, you can do the sequential experiment with time. But once the result, so normally instead of getting result, you will get instant result. Then remaining experiment to do, because sometimes animal unavailability. Okay, so first do the maximum doses. So in case of toxicity, we are doing in control rat or control mice, right? See, toxicity, first we have to check the behavioral study, either it is behave normal or abnormal, number one. Number two, you have to do some hematological test, right? Blood parameter, hemoglobin, this, CBC, like this one. Then you have to do some biochemical test. Biochemical test, kidney function test, creatinine, liver function test. Okay, some guideline, this kind of test. And if possible, they recommend to do ECG, some other advanced techniques, other advanced things. This kind of toxicological study, with this, you have to do it. Okay. And once you did the toxicology study, you find your chemical or agent or your drug compound is safe. Then your target is, you have to check your compound, either it is effective or not effective in your target disease. Okay, so someone is working on diabetes, someone is working on cancer, someone working on neuroscience, many people, someone is working for Parkinson's, someone is working anti-aging. So depending on your condition, depending on your aims, objectives of your research, you have to follow, you have to you have to check a disease model. Which disease you are working, make a disease model. So it is very, okay, what is the animal model, left side animal model, and some advantage or disadvantage. And this is the major advance of research that involved in animal model. So this animal model, it's therefore 1600. Okay, now it is 2024. So in 1980s, there is very breakthrough, 1980s, transgenic animal, and 1960s, monoclonal antibodies development, 1940s, embryonic development, okay, and 90s, antibodies, in 80s, vaccinations. All are some breakthrough in animal model study. So now come animal to animal. Rat, rodent animal. It is normally, it is easy to use, easy to handle. One is mice, another is rat. Out of two, which is dangerous, mice or rat? No, mice. Okay, in my presence in Panjani Center 13 years, I never found any rat bite someone, but I find mice bites many one.
But if one knows the proper handling procedure,
Yes.
it isn't bite. Just you have
There is many procedure.
told it
Yeah.
properly.
Yeah. Normally many procedure. Eh? So normally what I do, so I can do any experiment anywhere. Mice and rat. If you can make blind by, I can by shutting my eyes, I can cut everything. Okay. So if it bites from head or tail, head side or tail side, head side with mouth. Okay. Then what I'll do, 50 ml tube है ना, in 50 ml tube, उसका जो head है ना, I put it into 50 ml tube. Safe, secure. Very simple. ये पाकिस्तानी tips, बांग्लादेशी tips है ना. Okay. Make your life easy, especially the female. इसको move on कर दो. Safe.
So why mice will put his face in the tube? Do we have to put some bread there?
No. Some putting it is only so far because we have to do collect blood from somewhere. Na? If its mouth is free, so it can rotate. There's a chance to make it make back and bite it. Okay. There is some machine is there, strainer, we call it a strainer. If you put it here, lock the egg, stay there. But it's not all laboratories available this kind of instrument. But 50 ml tube,
Available everywhere.
if 50 ml tube is not there, what will do? What will do?
You should wear thick gloves.
So I'll use this bottle. ठीक है ना? Cut it, put it. So research देखो, research का ना, you need smart thinking, smart brain. और आसपास जे है ना, use it. If you order a strainer, it will after 3 months or 4 months you will get it. How do you use it 4 months? Somehow manage it, somehow do it. This is called smart thinking. Somehow your work should be done within today. Eh? So-
Okay, the mice spit.
Sorry?
Okay, the mice spit in this bottle.
Very simple. Just make it in this. You see if you cut it half of this little part and put it animal hair, only head part you can put here. Okay. Most important, wait. Most important, kuch jarurat nahi. Nothing is needed. You have lab coat, right? Lab coat in front. Do you have 2 pockets, right? In one pocket, uska jo head hai na, andar dalo. You got my point?
Yes, sir.
But yes, sir.
I think people and the broker is that is not also and we put like that.
Yes. वो जरूरत नहीं है. It is for experiment for other process. If you do dissect this and this on. For normally collecting blood 1 time, 1 or 2, 3, 4 times. No need. Normally, if we sacrifice the animal, okay, to dissect the animal, then this anesthesia is needed.
But if we use them for drugs and we have to put drugs in the tail and in the wing, and it is difficult to find the people.
Yes, it's difficult, not impossible. If you want to do, one of my student, Avira, okay. So if it's difficult, call my student. She'll come.
From Dhaka.
No, from Panjali Center.
Oh. Sir,
Yes.
there are chances the mice may die due to anesthesia.
Can you repeat, please?
The mice may die due to anesthesia. sir.
Possibility is there. Possibility is there.
But if you that's a long time.
No. Anesthesia written. Anesthesia is depends on dose. If it is high dose, okay. Normally you need animal. If it is animal, you need survival. Then you have to be very, very careful. But if you do the termination after experiment, you have to terminate this one. Then it is not important. But this kind of experiment for checking, you are giving blood, toxicity effect, anesthesia is not needed. We have to hold the animal, give that give or chemical by orally or by IP or IV somehow. Anesthesia not needed at all. Here, so animal handling is not easy. It's not easy. First thing, you need a love and affection for the animal. Second thing, you have to adapt the animal behavior. Then it is not difficult. Not easy, but not. If you want to do it, you can do it. If you are not very familiar, call my student.
We are recently working on treating mastitis through bacterial drains. So, sir, upon calculating our the specification of mice, sir, we come to the conclusion that other mice can complete up to 100 microliter liquid. So, sir, should we start with 100 or should we start with some lower dosage?
In bacteria phase, I have no idea.
No, sir, for an application, should we start with the higher dose or with the lower dose?
Higher dose. First start higher dose. Then you have the idea. Okay. Okay. So rat, the study of analgesic and anticonvulsant. So gastric acid secretion, hepatotoxicity studies, the study on male bioassay. Rat is better removing toxin from rat brain tissue. Okay. So what is the advantage? Most of the experiment is done. Most of the experiment is done either in rat or in mice. They're most widely used in clinical research as they're small, inexpensive, and easy to handle. Okay. Mouse are used in vast range of experiment. Many of these are classical. Many things say they have similar reproductive nervous system of humans and suffer from same disease. Their short lifespan. Okay, many things similar, and many things is not similar. Especially the reproduction time in mice is very less. Reproduction time in rat is little larger than the. Okay, so and one thing is mice and rat. Okay, become mother within few days or few months. Okay, that means you get lots of mice or rat in a small period of time. Number one. Number two, remember this thing. Remember this thing. It's mice and rat. It is normal or abnormal. If a human give birth a baby, normal. 2 baby, normal. 10 baby, normal, abnormal, abnormal. For mice and rat, if it gives less than 4, abnormal. At least 4. Normally, mice and rat, they give more than 8, more than 10, more than 12. Remember this thing, number one. And when you do experiment, okay, please remember, when we'll do experiment of mice and rat, okay, so one is your experimental animal, another is laboratory animal. From laboratory, you have to take animal, right, for disease. Take animal first, 20 animals or 40 animals. Take your experimental room first. Then don't start experiment the same day. Give some adaptation time, at least 7 days. Number one. Number two, never ever use either sex, male and female, mice or rat, right? And don't do mistake here. Don't put male and female mice and rat in the same cases. Clear? Difference between rats and mice, as I told you, is size. Number one. Okay, number one, size. Pregnancy time is different, and birth rate is different. And one more important is this body surface area, blood volume. Okay, so one mice weight is 35 gram, and in human, what is the total volume of blood in human? Total blood volume is 4 to 5 liter, right? And mice, what is the total blood volume? Total blood volume is mice 1 ml. 1 ml. And rat, mice 1 ml. Rat, no, 10 ml. Yes, You can take maximum 10 ml blood, maximum 10 to 2. So therefore, if it is 1 ml blood, mice, so from 1 ml blood, if you do centrifuge, you will get serum, right? Serum you'll get from 1 ml blood for human sample, 1 ml blood, you will get serum. What will be volume? 10%. Anyone? From 1 ml blood, human blood,
From one ml human blood.
1 ml human blood. So first make it easy. 10 ml, 1 ml human, 10 ml, 10 ml, if you centrifuge 10 ml blood, what will be the serum?
0.45.
Hmm?
0.45. 0.45.
No, he's right. 5 to 6 ml. 5 to 6 ml. From 10 ml. From 1 ml, you will get 500 microliter. If 1 ml human blood, you will get 0.5 ml serum, right? Mice and rat, remember this thing. Mice blood and rat bloods are more thicker than the human blood. So therefore, from mice blood, 1 ml blood, in case of human, you will get 0.5. But in case of mice, you will get 0.3. You got it? It's more thicker. You say more thicker. Same is true in rat. So therefore, if you do some biochemical test, you need ALT test, ST test, this kind of test, you need certain amount of volume, plasma. So if this kind of volume is enough for you, you can do it in mice. If it is this kind of volume, but in case of rat, 10 ml blood, right? If you centrifuge it, you will get 3 ml serum. This 3 ml serum is more than enough to all biochemical reaction, all biochemical tests. You got my point, madam? You got my point? Okay. So depending, so if you are doing some experiment, you are giving a lot of effort, lot of energy in mice. Ultimately, you will get very less amount of serum. It is useless. You can do 1 or 2 experiment. We can do 1 or 2 test. Remaining test you are unable to do it. It is meaningless. Therefore, you break. Okay, 1 minute. So you got the clear idea, mice and rat. So mice and rat, 90% or 95% research is done on mice and rat. So handling mice and rat very easy, not difficult. Just try to do it. If you can't do it, so call my student. Okay. And more important is thousands and thousands and million people are working on it. It is nothing new. Okay. So depending on your experimental condition, depending on your aims and objective, what is the expected outcome, what is the expected experiment you want to do with this blood or serum, depending if you need only one test is enough, 2 tests is enough, you can go for mice. But if you need many tests, many times, answer is only one. It is rat. Mice and rat. So another big difference from human development and mice development, normally from day 0, we can see. A baby can see his or her mother, right? But mice or rat pups, during birth, day 0, they can see or not see. Day 0, our development is a day during birth or develop our human development 100%. But growth and development. Okay, it's not development, it is growth. but in mice, growth is not 100%. So day 0, all eyes are blind. Okay, the pups are, their babies are closed eyes. Day 1, day 2, day 3, day 4, they can see it. This is the difference from human to mice, human to rat, and mice and rats more or less similar in characteristics. Only the body surface. So after here, we'll take little break for tea and coffee. After tea and coffee, inshallah, we'll join here. Okay. So tea and coffee, 15 minutes break. Okay. Yes, those are online students. Please, we'll join after 15 minutes, inshallah. After 15 minutes. Thank you. Just a while. Hello, hello. Yes, sir, please. Yes, brothers and sisters. Okay. So now up to now we read, we understand the mice and rat. Now let's see the guinea pig. Normally, normally it's common sense. Experimental animal with guinea pig. We are some kind of guinea pig. Okay. So guinea pig. So it is, as I told, guinea pig in the guinea pig, rabbit, same, but it is a larger volume. Okay, larger informed guinea pig. You can take 40 ml blood. Okay. Okay. Or if someone want to do, if you got the antibody, if you do on antibody, normally see guinea pig anti-antibody, insulin alpha rabbit, guinea pig or insulin alpha guinea pig. Most of the antibody are produced in rabbit and guinea pig. In case of polyclonal antibody, 100%, almost 100% monoclonal antibody is raised in mice. Monoclonal antibody, 99.99% monoclonal antibody in mice. Okay, the polyclonal antibody mostly rabbit, guinea pig. Okay, the vitamin B, vitamin C was discovered during this guinea pig experiment. Okay, rabbit enzyme, rabbit has been important in the study of cardiovascular disease. So monkey. So for that discovery, so this mice, rat, rabbit, guinea pig. So in this species, at least you have to use 1 or 2 species. After successful, you have to go higher range. This is the monkey, dog. So as I told you, the discovery of insulin, was tested in dog. Creating transgenic models. Okay. Animal models. In many animal models, this is important. Animal model got Nobel Prize in physiology and medicine. Many. Okay. How necessary animal models? As I told you, speak without that discovery, without animal model, you can't think it. Okay. How choosing an appropriate animal? Why we do it? Replacement, reduction, and refinement. We got some idea. With this idea, at least we can think what it will be either we get some idea, generate idea for our clinical trial. Okay. Animal model used in biomedical research, biology, behavior, spontaneous induced models. Okay, now as I told you, I work on diabetes. I'll share some of my experience very quickly. So diabetes, okay, diabetes, as I told you, Coca-Cola. Where there is a Coca-Cola, there is a diabetes. Everywhere you got diabetes. So you see there is red zone. Red zone, this is red zone means it is the more highest rate or highest number of diabetes. Pakistan is one of them. So in these cases, diabetes, how we can do diabetes? One is spontaneous, another is induction, another is genetical. Spontaneous is only this spontaneous is this is model GK model. Only Japanese people can do it. What they do? So if you 100 animal in animal from animal house, if you check their blood glucose, normally blood glucose, someone say here in Pakistan it is they consider milligram per ml or millimole per liter for diabetes. 0.2, oh, I got it. Milligram per dl, right? In normal people, if you collect check blood glucose, someone has 80, someone has 85, someone has 90, different ranges, right?
That's fasting.
Yes, fasting or anything. So same is true. All the animal, all the human has different range of within range, but someone is the lower range, someone is the higher range. Same is true in rat. If you collect 100 rats, if you get the blood glucose, someone has lower range, someone has middle range, someone higher range. The higher range rat, male and female, if you take it and breeding it, right? Breeding it higher range rat, then the generation after 4, 5, 6. So initially higher range, their child, their baby will be more higher, their child more higher, their child more higher, their child more higher, their child more higher. In this way, 10 to 12th generation, you get the rat, it is diabetic. It's called spontaneous. After long generation, okay, or many generation, it's called spontaneous in case of spontaneous model. It is not only for diabetes, many diseases. There is different way to make how to make spontaneous. Another is genetic manipulation. OB, DB, Akita mouse. Okay, chemical. If you give, normally diabetes is due to higher blood glucose, right? This higher blood glucose is due to less of insulin. So the insulin production factory is the pancreas. Pancreas, in the pancreas there is a beta cell. If you destroy the beta cell, then less insulin. If less insulin, diabetes. And another is nutritional model. We make the model, we make the rat or mice, we give high fat diet. Then it become more and more fatty. Then it gives insulin resistance. Then surgical, and there is a combination. Combination means high fat diet plus STG or STG means estradiol, nicotinamide. In different way we can make it. So see, this is the molecule. This is the glucose molecule, right? And this is the STG molecule. So only this is this position and this position. So only this OS group, this OS group is replaced with this group. So in beta cell, or inside to insert the glucose, there is a receptor. In the receptor, glucose bind it and it enter inside the beta cell. So in the chemical, it is similar structure. Instead of binding glucose, this chemical doesn't bind there. It goes into inside the beta cell and destroy the beta cell. It depends. If you give high dose, destroy 100%. Next day, animal will die. If you give partial destruction, 50%, 60%, 40%, that means 50% beta cell die. That means your insulin production is half, and the blood glucose will be higher. This is the principle how we make it. You got clear idea? Okay. So this is my madam. She's from Dhaka. So I learned all the technical initially. She teaches me, and this is Animal House at Panjani Center. Right side, I told you this is the baby, rat pups, 2-day pups. But in the different model, we have lots of experience of making animals. What we did, please, so in 2-day-old pups, we give streptozotocin injection. So idea is that, remember very carefully. So in the 2-day pups, we give streptozotocin, 90% beta cell destruction. Clear? The 10% beta cell, normally in the early stage, there is a growth, more growth, regeneration, more growth, that it means initially insulin is less after 2 days. Then due to regeneration, it is 1 or 2 months, it gains some beta cell, but not 100%. Okay, not 100%. That is mimic in your condition. In non-obese diabetic patients, we have less beta cell, less insulin, we have insulin secretion deficiency, we have diabetes. In case of non-obese people. For obese people, you have more insulin, but it is inactive. We call non-obese diabetes, another is obese diabetes. What we do in this model, in the pups, we give streptozotocin, and after 9 weeks to 10 weeks, we check the blood glucose. We found, yes, some of them develop diabetes. When with this diabetes model, after another week, we did some experimental test, either it is extracts of pure compound, either it is effective or not effective. Okay, first important note for animal model development. Dekho, OGTT, oral glucose tolerance test. Okay, even oral glucose tolerance test, you have to do it. Either normally this is the control rat. Even control rat, species to species, it differ. The peak. Normally, human, then if you take 75 gram glucose at 30 minutes, there is a peak, or 60 minutes, there is a peak. But the animal, SD rat, oyster rat, they showed different physiology. So normally, in human, we give 75 gram glucose, right? 75 gram glucose. The ideal is 1.25 gram glucose per kg body weight. Okay, same is true. In case of human, 1.25 gram glucose, but in case of rat, we're giving 3 gram per glucose. How we did it? We did different tests. 3 gram glucose, we checked 2 gram, 2.5 gram, 3 different doses we checked it, and we found that 3 gram give the best result. Therefore, we use this one. Then with any test, you have to do, at least you have to do three doses, and the maximum and optimum doses, maximum optimum result, you have to use this one. With this model, this is the diabetes, this is the control. Okay, remember this one. This is what is the difference in control. After 2 hours, it is almost the baseline, right? But in case of diabetes, it is baseline. Even it is 2 hours, it never ever come to the baseline. This is the big difference. Okay, number 1. Number 2, the peak here, it is very less, but peak here it is very high. This is another big difference of the diabetes successful model development. We did it, we checked it, either it is intolerance or not. Yes, we found it. Okay, this is the fasting glucose, 127, fasting insulin, and found this is the homobias, that means insulin secretion deficiency model. We checked, and finally, this is the beauty of my expertise. The left side, the control rat, right side, in the diabetic rat. You see left side, all the islets. This is the pancreas tissue. This is the pancreas tissue. This is the pancreas tissue. Okay, here islets. This is small, medium, large. Different size of islets is available here. Right side, all are small. It means all are small. That means the islet is there, small size. If factory is small, production should be small, production must be small. What happened exactly in non-obese diabetic subject? We did it, established this one, and we did a lot of publishing with this one. One is this model, it is the non-obese. Then what we did another obese model. This is the normal pathophysiology of diabetes. Normal pathophysiology, that means diabetes don't occur overnight. It takes long time. Initially, for obese people, obese, right? Obese, overweight, obese. The people impaired glucose tolerance. This impaired glucose tolerance, after sometimes later, they become diabetes and they have diabetic complication. So using this same formula, we develop a obese model, a long-term high-fat diet, low-dose streptozotocin developed in diabetes, type 2 diabetes rat model, showing clinical presentation and pathophysiology of natural history of diabetes. What happens in normal history in diabetes? Same thing happened here. You see it here. So this is the high-fat diet. Okay, we give the rat, and that is normal 200 gram. It get 450 gram. So you see the high-fat diet for 9 months. We checked high-fat diet 9 months. Very interesting. We found at 3 months it developed insulin resistance. 6 months it developed pre-diabetes, and up to 9 months pre-diabetes. So only diet cannot make you diabetes. Then what we did at 6 months in pre-diabetes, we give low dose of streptozotocin. After 15 days, we got diabetes. This is the obese diabetes. We found blood glucose, 2-hour blood glucose, HOMA-B, HOMA-S, everything we found. That is, this is the right side. This is the characteristic of this is normal. This is IGT type 2. We found the data after 3 months, 6 months, 9 months. This one, it is very similar pattern of the diabetes, pre-diabetes. This one, our model. Okay. Then first time in Pakistan. So during my PhD in Japan, after when I come back in Dhaka, everybody work in diabetes. So I introduced a new field, pre-diabetes. So once you are diabetes, always your diabetes. You cannot reverse it. You cannot manage it. But it is the only stage of pre-diabetes in your life. Pre-diabetes. Someone is normal. Okay. If your blood glucose is 100 milligram per DL, you are normal. If it is 127, you are in diabetes. Then 101 to 126. In between period, if you got blood, so upper of normal, above of normal, but below the diabetes range. It's called pre-diabetes. This is the golden period of your life. This is the pre-diabetes. It is in your hand. So pre-diabetes, normally 33% pre-diabetes go to diabetes. 33% diabetes, pre-diabetes, stay in pre-diabetes. 33% pre-diabetes go back to normal stage. That means it is the only stage in pre-diabetes. It depends on you. Only lifestyle modification, food habit, lifestyle modification, only no medicine is needed. Only lifestyle modification can take you from pre-diabetes to normal or pre-diabetes to diabetes. If you don't care, if you care, okay, very interesting. As I told you, all of my students, okay, he got his degree. We developed first time in body weight increasing, right? High-fat diet, normal diet, high-fat blood glucose. This is the fasting blood glucose. This is the 2-hour glucose. This is the fasting serum insulin. Insulin is high. Insulin is high compared to normal. You see, red one is the insulin. Initially same insulin, and 2 months insulin is double, and 4 months insulin is more than that. After 6, then insulin is less. Insulin is more than control, double, but it cannot work. Okay, it's called insulin resistance. Insulin is there, it cannot work. This kind of model we develop it, right? We check HOMA-B, HOMA-S, other things. And this is the pancreas. In top side, this is the control diet, this is the high-fat diet. So you see, my previous model, in the control diet, you see, there is a small, medium, large, different size. In case of diabetes, non-obese diabetes, only small. But in case of obese pre-diabetes, you see, insulin is, as I told you, insulin, see it here, insulin double, triple, right? See it here, insulin double, triple. That means the islet size in volume size is increasing. Therefore, the islet size double, therefore beta cell double, insulin double. Okay, the lower is the large images. So this is the adipose tissue. This is also this. Okay, this is the first time in Pakistan. This is the first time in Pakistan I established this one. In the islets, in the same islets, you can see insulin. Red one is the insulin cell, beta cell. Green one is the alpha cell that produce glucagon. Or blue is the nucleus. In the same cell, same section, you can see alpha cell, beta cell, as well as nucleus. So this is the first time in Pakistan I established this kind of triple channel immunohistochemistry in Pakistan.
So which protein you have targeted?
It is insulin and glucagon. Red one is the insulin. Green one is the glucagon.
So you have made the antibodies against that?
No, I purchased the antibody. It takes 6 months for me to establish this one. Okay, as I told yesterday, the diabetes, all the death due to not diabetes, due to diabetic complications. So neuropathy, nephropathy, and retinopathy. Okay, with passage of time. Okay, so how you can understand this one? Its marker is the HbA1c, glycation. Okay, normally you know the test HbA1c. HbA1c normal range is no 5 to 6%, right? It means if glucose molecule and hemoglobin, normally 5 molecule of glucose attached with hemoglobin. If therefore that means out of 100 cell, only 5 cell attached with glucose. It called glycated hemoglobin or HbA1c, right? Your glucose is 100, but if diabetes, you have 200, double. That means it is called non-enzymatic glycation. That it is the only test you can predict the 3-month story. Normally, blood glucose, we call it flash photography. Every second, blood glucose changes. Every second. If you are very much afraid, blood glucose go high. If you are over-fasted, low. Every second, your blood glucose will be fluctuation. But it is the HbA1c, we call it continuous video monitoring, right? A cinema, 3 hours, 2 hours. But if you see one picture, one song, you cannot predict the cinema. But if you see the total story of cinema, you can understand, yes, you can got the story. HbA1c is the 3-month history of a patient. Okay, so if 1% HbA1c you can down, it can save 33% diabetic complications. Got it? So one of my students, we did many things. Okay, we developed diabetic nephropathy model. Blood glucose, this one HbA1c and urinary albumin. Okay, after 6 months, it developed diabetic complication model, and we tested this one. Okay, many things we tested, either the diabetic nephropathy model. Many things we checked it. Again, here you see diabetic complication, insulin, glucagon, DAPI. You see, insulin is the red, glucagon is the green, and DAPI is the blue. This is the protein, sir. Okay, I make it. And one is HbA1c, we call it early glycation, and AGE, we call it advanced glycation end product. So little by little, if you have more diabetes for a long time, so not only glucose, many things is deposited in your body. So in your water pipe, so water is flowing, right? Water is going. With passage of time, inside the pipe, there is something attached with this one. With 1 year, 2 year, 3 years, something to make it service. Otherwise, the initial days, the flow of water, or 2 or 3 hours later, if you don't service, the flow of water will be same or not same? Not same, because initial diameter was larger, but day by day, something is deposited inside. The narrow, it will be narrow. Same is true in case of blood glucose. In case of blood glucose, you see, I'm giving very simple example. You are normally in Bangladesh, we call it a river, right? A river. Water is transparent. Your ship, boat is going smoothly, right? But if the water is too much dirty, the water will be thick. Then your boat will be goes smoothly or no? the fish is there, many things is there, they cannot swim in this one. So your blood glucose, blood, normally it is glucose is 100 milligram per dl. But if it is 200 or 400, that means in the blood, more glucose, your blood is turbid. Okay, if you see it, 1 glass water, 4 teaspoon sugar, it will be transparent. If you take 10 sugar, 10, it will be transparent or turbid. Same is true. Then cannot be everything, all enzyme, protein, everything, hormone, everything move in the blood. So if it is narrowness is there, these things, all the things cannot go forward. Then it gives backward pressure. It makes diabetic complications, cardiovascular disease. Okay, so it is this one, and it's all here. Retinopathy, there is an out. This kind of these things, advanced glycation end product. Okay. Finally, how to make genetic model? As I told you, this is the structure of insulin. See it here, one disulfide bond here, one disulfide bond here, one disulfide bond here. Okay, see it here. If we make this disulfide bond, if we replace one cysteine residue to alanine, there is no disulfide bond. It lost one disulfide bond. Okay, so in this way, if you make a genetic manipulation and cross it, it gets some mice, we call Akita mouse, and it is the genetically manipulated diabetic rat or diabetic mice. Okay, and Professor Izumi, okay, one of my collaborator, he developed this one, and Abdul Hamid, one of my first PhD student, okay, after doing PhD, he also did postdoc here, and he was in Abbottabad Commonwealth University for 1 year. Now he's a faculty member of Ziauddin University, Karachi. Okay, he's working. So finally, okay, some tips and tricks for development. Make your life easy, healthy. So the bed, if you have a good bed sheet, good pillow, you can sleep well. But it is winter season, bed is dirty, and sometimes bed is not dry. Okay, in winter season, rainy season, if some water came in the bed, you can sleep it, you cannot sleep. You can't sleep. Okay, same is true. Bedding is important. Aging, food, water, bedding. So if you don't sleep the last night, the next day, your 50% efficiency will be down. Your mentally will be aggressive. Sleeping is the best medicine for all disease. Remember, sleeping is the best medicine for all disease. Sleeping is the best medicine. So therefore, I found if you make diabetes, normally, say one rat make in 24 hours, it make urine 5 ml, 3 to 5 ml maximum. Remember, so we put 6 ml, 6 rat per kgs. That means almost 20 ml urine. Got my idea? So normally every alternate day we change the bedding of animal. But in case of diabetes, only one rat make 30 ml urine. That is one diabetic rat urine equal to 6 normal rat. That means if you put 6 diabetic rat in a case, what happens? It will be flat next morning. So they cannot sleep well, they cannot stay well, they'll find in this way. They'll always stand in position. Okay. So therefore, if this is very important, then if you work on diabetes, option 1, you have to change bedding morning, afternoon. Option 2, put minimum number of animal. So I am telling you the diabetic model development is not easy. For changing the bed or taking care of the animal, I hire one research assistant, laboratory attendant. Otherwise, your animal is not happy. Yes, stress. Yes. Okay, you see, everybody like Mona Lisa, but if it is right side one, yes, sir, please.
diabetic mice survive after
Yes, it's very good question. Their mortality rate is higher, and normally that okay, their survival rate is also less compared to the normal rate. We have so and in Panjani Center, I have none of this kind of rat. I don't have any genetical motility. But one mice I got from my colleague from Germany. It's called obese mice. So normally, as I told you, the mice gives 10 child, 8, 9, 10. The genetically modified mice or rat, their reproduction, 1 month, 2 months, 3 months, no baby. Okay, after many sympathy, love, I got only once that piece. And unfortunately, I tried to keep them. I put one student. Okay, ultimately we tried, but we couldn't make them alive. Okay, so it is a good question. Genetically, modifiably, a rat, mice, they need a special environment. They need a special food. So their mortality rate is higher compared to the normal rat, and their fertility rate is very low. Very low. Yes, sir, please.
Another question is that as the diabetic genes are switched on, so how will we predict that our medicine or our trials are working? Because if it's present in their genes, so how can we predict based on our experiment or based on our trials that it will work on that? Because if it is in genes, we can just modify it through like trial or any psychological modification. We can't treat it completely. So genetically modified diabetic mice is good for experimental work or not.
So as I told you, okay. So your question, I put it remaining. So I am studying another session there, in vitro to in vivo. The last slide, the answer is in your last slide. Please wait.
Okay, thank you.
Your answer is there, last slide. Yes, sir. Can you ask IT people, IT man outside, IT man. So this is a study of model, how to develop a good model. So you can make a model that is can just make it off. Twenty-two. Yes. No, not this one. Yes. Yes.
Yes.
Yes. Now, okay. So this is the best you develop how to translate in vitro doses to in vivo. Normally, all experiments are done. Initially, all the experiment is done in test tube or in cell line. Ultimately, you are getting some idea. Then, finally, you have to do experiment on in test tube, or normally we do an experiment on 96 cell plate, right? Either it is 96 cell plate or appendix tube or test tube. Which one is more important? It is volume or concentration? Concentration. It's volume, it doesn't matter. Concentration. If you make in the 96 cell plate or appendix tube or test tube, normally we do the calculation milligram per dl or microgram per ml, right? Microgram per ml. So if you do a 96 cell plate, in 96 cell plate, what is the total volume? 96 cell plate? 300 microliter. Exactly. What is your name, sir? From which university you are? Mashallah, mashallah. What is the volume of appendix tube? 1.5 ml tube? 1.5. I told you.
That's a total 300 microliter yesterday.
96 is 96 cell plate. Appendix tube? 1.5. What is the volume of test tube? Sorry? I know it varies. What is the appendix tube? In appendix tube, it also varies. It's 0.5, 1, 1.5, 2. But in general, 1.5. What is test tube? 10. 10 is normal. 10. So either it is 300 or 1.5 or 10 ml, doesn't matter. We consider concentration. You know, Amir Khan, what is the name Amir Khan? PK. Normally, sometimes if someone offer you the tea, so everybody asks, sir, how much sugar you need? 1 spoon or 2 spoons? He asks, you want tea? He asked, please show me the cup. Okay, a cup, cup. Then please show me the spoon. Okay, if the cup is too big, in 1 spoon, then sugar concentration is less. If the cup is small and spoon is big, then it's high. Okay, therefore he called this Mr. Perfectionist. Okay, so that means if a small cup, a small spoon, 1 spoon, big cup, a small spoon, then 2 spoons. 2 spoons make the similar concentration, right? It is the concentration, not the volume. So now come to the point. Okay, in vitro doses to in vitro. In vitro means it is inside the body and outside the body. Okay? In glass. Okay? It is not inside, not outside. Outside the body, it is ex vivo. In vitro, it is in test tube. In vivo, it is in test tube or outside the body. Inside the body, in living condition, right? So as I told you, there is many model. There is many model. Fish model, bird model, animal model, this model. So it is impossible to determine experimentally a dose for all species. Okay, you did some in vitro result. Now want to do what is the dose? Dose, it is depends on many things. Now you see, range of body size within a species require extrapolation. One is adult to adult, another young to adult. Number 2 is it is impossible to determine the experimental dose for all species and breeds. How to extrapolate a dose from an other species or within a given species or from in vitro data? It is so it is impossible. Impossible. But how it make human it possible? So when I was a student, biochemistry student, anyone here in biochemistry student? Can you raise hand? Okay. So there's a book, textbook, Albert Streyer. Did you see the book? Anyone? This book. Okay. when I was a student, in DNA sequencing, there is a DNA sequencing or human, just one few paragraph. It is written there. So human has trillions of base pairs. So DNA sequencing, if one base pair cost $1, then it is impossible to do human sequencing. In 1993 or 94, this is the year. It is clearly written in the textbook of biochemistry. It is impossible to do DNA sequencing. In 1994, in year 2000, human genome sequence done. Impossible to make it possible. Okay, everything is possible. Everything is doable. Okay, you need sincerity, honesty, hard working, and integrity. I also need you have need infrastructure. Okay, then how it is written impossible, but if it is impossible, everything is impossible. But if you try, you can get it. Okay. Cow give milk. इसका उर्दू क्या है भैया? Cow दूध देती है. It is true or false? False. दूध का निकलना पड़ेगा. देती नहीं है. ठीक है. So, देखो. So if you sit with your cows and your mother told me, okay, cow gives milk. If you stand there, so it's not giving the milk, ना निकलना पड़ेगा. ठीक है ना? कुछ तरीका है. तरीका ढूंढना पड़ेगा. How we can make it impossible to possible? Okay, sit here. Dose determination, the parallel design. Okay, complicated, costly, and ethical aspect also. You see in the left side, if you see 3 doses, okay, so 1, 2, 3, 4. It is the placebo. Placebo means no drug, okay, and we give the drug, what dose 1, dose 2, dose 3. See the figure clearly. In the dose 1 and dose 2 here, placebo here, this is all of 4 data, okay, and dose 2, dose 1, it is maximum here. That means you see here, this one and this one is common, both placebo and dose 1. The upper 2 one, that means 50% is different compared to the placebo. If 50% is different, significance. Without doing any statistics, you can do it statistics. Okay, and here those 2 is more significant, and those 3 and those compared to this those 2 and those 3, here no big difference. That means it is significant, it is more significant, and it is similar to this second dose. Then this is the medium, this is the dose 2 is the optimum dose. You got my point? How to select the optimum dose? People say 1, 2, 3, 4 doses, which is the optimum dose. You can see the optimum dose. Now, using in vivo data between species from rat to man or dogs within a species to species. How can we do it? There is some people, though it is impossible, the people did a lot of work because it is impossible. People do some things and people make some formulation how we can solve the problem. Size matters. Size matters. Normally, initially, you are taking the medicine, it is single dose. But initially, when drug development started, it became dose per kilogram body weight. Per kilogram body weight. Okay, one is, देखो, one is body weight, we call it body mass index, BMI. Either it is completely depending on your body mass index, body weight and height. Another is BSA, body surface area. One is BMI, another is body surface area. So if your weight is 70 kilogram, your height is 6 feet, and weight is 60 kilogram, and height is 4 feet. Weight same weight. Someone is 6 feet, someone is 4 feet. Okay. Then body surface area will be more better. Okay. See it here. So scientists found that, you see, left side, different species. Okay, mouse, rat, infant, child, adult. What is the body weight of a mouse? 18 gram. Rat, 250 gram. Infant, 8 kg. Child, 20 kg. Adult, 70 kg. Right? Here you see, this is the body surface area, and this is the body weight. So if you consider dose per day per milligram, you see mouse, rat, infant, child, and adult. It shows different doses. If you consider only the dose per day, if you consider dose per day per milligram, per day, per dose per day milligram per kg, that means we consider the body weight. You will also find from different days. But if you consider the body surface area, you will find 3.6, 2.8, 3.1, 3.1, 2.7. That means either even different species, mouse, rat, infant, child, adult, you will get more or less similar value. Therefore, it is more appropriate. Comparison of body surface area and weight-based doses, protocols, and this study indicate that the body weight-based dosing regimen may result in more uniform therapeutic and toxic response in doses. However, differential from you see it here. So this kind of doses, this kind of information we needed for our experimental, normally pharmacokinetics and pharmacodynamics study. This is needed. See the interesting doses extrapolation using the clearance concept. Okay, so there is many. So one species, see it here. How to if there is two species. If you got the clearance data, okay, dose species 2. This is the one. Dose rat by clearance rat equal to dose man divided by clearance in man. In this way, either it is interspecies, human to rat, human to this one. If you got this dose as well as clearance rate, you can calculate anyone, a dose for human or dose for rat. Okay, dose species 1, this species 2, clearance species 1, dose. Very simple calculation. In this way, you can measure any species. Yes. Sorry?
You see what you see
area under the curve. See here, what is the morphine doses in dogs and rats? Okay, so human usual dose, clearance, and complete dose. And this is another important thing. So one species to another species, there is many things difference. One is size matters, right? So other than size, anything from mice and rat, anything is different. Size matter, right? So mice and human, size matter, number one. Any other thing? What is this one? Speed. Okay. Another and any other? Any other?
Body weight.
बॉडी तो पता है मुझे और blood flow. Blood flow is 50 seconds here in human size and 60 seconds. Number one. So heartbeat and heartbeat. Heartbeat human heartbeat is more or mouse heartbeat is more. Mouse ज़्यादा है. Heartbeat of human is more or elephant is more. Human.
क्योंकि वो सारा सफर करके वापस
Okay. So the blood pressure in mice is higher or human is higher?
Mice.
Mice. Okay. So mice is faster or human is faster? Mice. Mice, there is some difference, and most important is metabolic rate. Metabolic rate is human and mice. Normally, human takes food 3 times: morning, noon, at night. Normally, right? So, and mice has metabolic rate 5 times higher than the human. Listen carefully. The metabolic rate is 5 times higher in mice compared to human. That means if human has the metabolic rate similar to mice, what will happen? What will happen? You are taking food 3 times, 15 times. That means you will take the food for 15 times. That means without sleeping, only except sleeping, every hour you have to take food. You make your life it is when if you take food and food and food, how do you work? So that means it is very similar. If you got one dose, it is effective in mice, in rat, sorry, in human, the dish should be similar or more or less? Less. How many times?
5 times.
At least 5 times. This is very simple calculation. Okay, at least 5 times. Okay, we call it in vitro, in vivo correlation. So in vitro, in vivo correlation. Let's see little by little. One is metabolic rate. Why do larger animals have lower metabolic rate? Because as I told you, so elephant has less metabolic rate compared to human. So even it took lots of food, elephant. So more metabolic rate it takes than in the rat or mice, 24 hours. They're eating and eating and eating. They eat everything. Okay. And one thing is big difference in mice, they're active in night. Active at night. Sometimes if you do experiment with mice or rat, if you go to animal house, you'll find their mice or rat are sleeping. Okay, that means they sleep at daytime. At night, sometimes we work on diabetes and we have to go at night to remove the food to make them rat fasting. My suggestion is, and it is ethical point of view, never ever go to animal house at night alone. Got my point? Never ever go to animal house? Hello. Even if two person take torchlight and please take a stick. Sometimes snake came in animal house. Okay? This is the real experience. Okay, this snake came here because they took the baby. If rat and mouse baby, snake came here to eat. Okay, and the difference is that, okay, this is one big difference of human and rat and mice. If rat and mice thinks my baby is in danger, either snake will come, or snake is coming to take my baby, or human is coming to do experiment with my baby. Mice or rat will eat his own baby. It is common. You are doing experiment, you saw the puffs, next day no puffs. Possibility to himself, herself, or snake. It is common. Therefore, okay, during experimentation, that mice they are smart enough. Okay, therefore, the adaptation, love and affection is needed for the. Anyway,
How we should treat the mice?
okay, normally experimentation during experimentation. So don't do experiment. Okay, so if you want 4 cases, how to do? Then one experimental should to put the animal somewhere. If you do experimental, take 1 cases in experimental room. Don't, when you sacrifice the rat, okay, don't sacrifice the rat in front of others. Okay, normally in middle somewhere you will sacrifice 1 rat, take only 1 rat to the sacrificing road. Okay, this is the only way. Otherwise, if 5 rats, 1 rat's already sacrificed, then 4 rats, they understand the next time maybe my turn. Okay, they're smart. You are smart, they're also smart. Okay. Now, see this metabolic rate in human 138 kilojoule per kg body weight, and mouse 961 kilojoule per kg body weight. Metabolic rate, that means 100 many times less. So therefore, they need lot of energy. They need lot of food. And another difference is digestive system. Our digestive system is small intestine and large intestine. You know, which one is longer, small intestine or large intestine? Small intestine is larger. Okay, large small it is wider, but small intestine. Okay, that means if it is a small size, okay, then you will take, so that your food will take long time for digestion. Okay, so another difference is the digestive system is shorter compared to the human. Therefore, they need food. Okay, they need food. Difference between rats and humans. Okay, they have fermentation chamber. They can digest cellulose. Human digestive system is physically large. Human digestive system is physically large compared to the system in rats. Rats have a specialized digestive system, whereas human have a simple system. Now come to the point. Okay, now to the comment. It is very difficult or impossible. This. So someone make your life easy. Someone make your life easy. What is the dose in man? What is the dose? If you have dose any dose for human, you can convert it to mice or rat. Or if you have dose for rat or mice, you can convert it human. So left side it is a human dose, right? Human dose. If you want to make it animal dose per kg body weight, so then there is a formula. So you have to divide animal dose by this, or you have to multiply dose this one. If you make dividation, you will get the dose for animal. Or it is rat, Okay, if you want to do mouse to rat to mouse, or human to rat, human this one, there is some formula, just conversion. If you make mice to rat to mice, human to rat, or human to mice, there is a formula, conversion factor. You just give the conversion factor and you automatically get the dose. Conversion of animal dose to human dose, equivalent doses, human equal doses by using the exponent of 0.67 for body surface area. Okay, it is mouse dose. You see, it is mouse. High human efficient dose for animal divide. If it is mouse, this dose, if you divide by this one, you'll find this dose. Or either mouse dose, you will divide this 12.3, or mouse dose, you multiply point this factor. Then dose, you'll get the human dose. Mouse dose, hamster dose, rat, guinea pig, rabbit, dog, monkey, this is the dose. Okay, and if you divide with this, the dose you will get for the human, roughly, not exactly, roughly. Okay, yes.
If we are performing the experiment for the very first time, and we don't even know the rules for animal and also not used by human. So what should we do?
Now, initially, there is some accidental discovery, blind approach. Nowadays, there is no blind approach. If you don't know anything, you have no right to do any experiment. Now, this is the formula. You have to run. If you want to come in Islamabad, comstech, first you have to check Google Map, where I am, where I have to go. Otherwise, if you ask if you ask Mr. X, Mr. 1, Mr. 1, your life will be misguided. You may come in comstech, or you may go to some other places. So, another interesting story. So in Bangladesh, we have some sheep, lawns, sheep. So someone came from sheep to city. He thinks in the city also sheep is there. He asked, by which sheep I can go from this to this? Someone asked, okay, he came for this one. He was over. Then he took another sheep and again he put him from town. Okay. Then nowadays there is no way blind experiment. Okay. You have to do all the experiment in your computer. First, then you have to do all the calculation at your notebook, in your hair, then in practical. Okay. So during World Cup cricket or World Cup football, they play for 30 minutes or 90 minutes like that, right? So for that, they practice 4 years to play 1 hour. Okay, there is no blind approach. So here, देखो, human body weight and rat body weight. Okay, rat body weight, you see it here, rat body weight, and it is the human body weight. You can calculate. If it is 200, rat body weight is 200 gram, and human is the 70 gram, right? You can put here to here, this one. This is the factor. Just multiply this factor, it's okay. You got the human dose. That makes your life, your experiment easier. And to scale or not to scale, the principle of dose extrapolation. So normally you see mice, 30 gram, rat, 200 gram, human, 60 kilogram. Okay, that means if you consider only the metabolic rate, then 5 times lower. Normally, remember this thing. Normally 5 times lower theoretically, but practically, normally we make it at least 10 times lower. Okay, student, My dear brothers and sisters, remember these things. If you got any experimental result, you want to follow it. Any experimental, so you got 5 milligram per kg body weight. ठीक है से? So you got someone published result. This the optimum result. They got 5 milligram per kg. Then, if you want to do experiment, what you will do? You will use 5 milligram per kg, or you will other doses. 5 milligram per kg. This is the someone published papers, and they found 5 milligram per kg, right? What will you do? You will use the same dose, or you will do different doses. Okay. No, it is later. My very simple question. It is 5 milligram per kg. Okay, you got some reference in there, 5 milligram per kg. So you want to do similar kind of experiment with the similar kind of animal and similar kind of compound. Okay, what will you do?
So one will try to replicate the same experiment by using the same amount.
No, remember this thing. So best way, don't believe anything. Okay, if my professor told me, if you want to, okay, someone did this experiment, this is the dose. Okay, best way, use this dose and use half of the dose and use double of the dose. Got my idea?
Yes.
Okay, if there is optimum dose 5 milligram per kg, then use 3 doses, 5 milligram, another is 10 milligram, another is the 2.5 milligram. So if you do 3-1, so remember this thing, human, okay, so one of my students did first MPhil, we found many differences. Remember this thing, yes sir. So if you do some test, blood test in laboratory in Islamabad, and if you do some same test in laboratory of Abbottabad, in Islamabad, 2 different laboratory, you will get the same result or different result? Different. That means 5 to 15% vary. It will vary. If 15% vary, it will acceptable. Sometimes, okay, acceptable. So in rat, okay, in rat, remember this thing, many things. So laboratory animal result differ from laboratory to laboratory. So laboratory in Islamabad, laboratory in Karachi, maybe because laboratory in Islamabad weather is comparatively cool compared to Karachi. So that means weather is weather, because all the reaction depends on temperature. Okay, so laboratory animal data differ from laboratory to laboratory. Number 1. So the European data, European is 9 months, 10 months is cool. Pakistan 10 months is hot. So another is laboratory to laboratory, one is country to country, and even so it is the species to species. Their species is rat, say albino rat, your one is the Worcester rat. Sometimes differ. Okay, it is very common. Therefore, their food, European countries they are feeding, and in Pakistan their feeding is different. So therefore, my student, my colleagues, my brothers and sisters, remember these things. Okay, don't follow exactly. You have to do your own way of thinking. Therefore, so if someone got the result, use it, but uske saath make 2 different doses. It makes your experimental result easy success. 3 doses, chances there, more success. Okay. Guidance for industry, estimation of maximum safe dose, safe starting doses and initial clinical trials for therapeutic in adult healthy volunteers. in vitro in vivo correlation from their theory to application. So there is no hard and fast rule. You have to do some experiment, you have to get some idea, then you can empirically you got the result. Okay. Okay, as you know, there is in class in drugs. Hello, it is working now. So there is 4 class of drug. Okay, one is solubility, another is permeability. We normally do in the school left right is again high low high low. Left side solubility high low high low. Right side high high low low. That means some drug is high solubility, high permeability. Another is low solubility. So even competitive compound, it's not only dose. If you high solubility, high permeability, it takes low dose. If it is high solubility, low permeability, it takes more doses. Okay, so there is many factors. Okay, so here in Barde, my work in diabetes. Okay, see it here. Here, this is the oral glucose tolerance test. They did, it is the long event rate. This is the long event rate and the glucose tolerance. We got the maximum is the in 15 minutes. Maximum peak of the blood glucose in the 15 minutes. When I in Karachi, in Panjani Center, sit here, we got the peak at 30 minutes. It is in Worcester rats. A species difference. Okay, a species difference. You sit here, Worcester rat. We finally found that we did someone give at 45 minutes, 45 minutes, 45 minutes, 45 minutes. Sit here. I came from Dhaka, so I have experience. That means maximum glucose tolerance, the peak it is in 15 minutes. So the peak in Dhaka rat, peak in Karachi rat may or may not say, okay, if you do experiment, lot of experiment, you'll get it. It is 30 minutes. Later we found that at 3 gram, it gives peak on 45 minutes. Okay, so 3 gram glucose per kg body weight. Okay, in case of rat, but human, in human normally we get 75 gram glucose for whole human. See this peak hit here in Worcester rat and it is SD rat. 2 different species give peak in 2 different times. That means data control depends on, it vary from laboratory to laboratory as well as species to species. Okay, sit here with this peak, we did lot of tests there, we published papers. Okay, and glibenclamide we use as a positive control. Okay, and always the reviewer asked, what is the logic? You are using glibenclamide, this is the concentration. So you are using this compound, this is the concentration. What is your logic? Then you have to give. The previous study we did this, and finally we select this one. You have to give some logic and with good explanation. So yes, my dear brothers and sisters, 0.9% sodium chloride. Can you calculate 0.9% sodium chloride in millimolar? What is the millimolar concentration? Normally in saline, available give in saline, we call it 0.9%, right? Can you calculate?
Zero point one molar.
0.1. 154 millimoles. Anyone? 0.1. Okay, 0.1 means 100 millimolar, right? 100. 100, 154. Anyone? Anyone? Zero 0.9% sodium chloride in millimolar is 100 millimolar. Someone told 100 millimolar. Someone told 154 millimolar. Any more? Yes? No. 100 millimolar. Okay, you are absolutely wrong. Dear brothers and sisters, for experimentation, you need a good calculation. You need perfect calculation. Okay, so if you don't know the calculation, learn it. Okay, learn it fast. If there is a formula, okay, remember this thing. There is a formula, so it is G. So if you want to make, okay, 1 molar solution, G equal to molarity multiply volume multiply molecular weight. So if you want to make trees buffers, okay, so molecular weight is 121. So molecular weight is constant, right? So if you find any compound, any chemical, molecular weight is written there. Yes, who told 154? Absolutely right. Okay, absolutely right. Okay, Martin, please read. Okay, volume, it is always on liter, and mole, always in molar. So 0.9%, that means 0.9%, right? 9 gram. 9 gram percentage means 100 ml. If you put here the formula, that means 9 gram is here. Okay, volume is 100 ml. Make it liter. Molecular weight is, put it 0.9%. Okay, in this way, this is the formula. G equal to M multiply V multiply molecular weight. So in this way, either G or M, anything you want to do it, just you can put it using the single formula. Using the single formula, you can do all calculation all your life for your experimentation. Do it. So 0.9% sodium chloride, how it become 154 millimolar. It is your home task. Do it. If not, today, those colleagues did it. Okay, learn it. Because if you do the calculation wrong, everything will be wrong. Okay, I'm showing some of my experience. Okay, the allergic acid, we work on some developed diabetes, we work on in vitro, we work on in vivo. Okay, see one example. Look, we use in vitro dose allergic acid for 200 micromolar. This 200 micromolar, as I told you, if I 200 micromolar is equivalent to 60 microgram per ml. So this allergic acid, we use this dose, we found it is this one. When you convert in vivo, show it very carefully. This is the last example. So that means this is the in vitro. We got it in either cell line. Okay. Then we want to test it on rat. See it here, 60. This is the dose, 60 microgram per ml. This is the dose we got in vitro. This dose we are going to put in rat. So what we did, see this is the 60 this microgram per ml, 2 rat. 1 rat, as I told you, 1 dot is, it has 10 ml blood. we multiply 10. That means 604 microgram per rat. That means 0.6 milligram. One rat is the weight is 250 gram. So this 0.6 milligram we multiply 4 here as well as 4 here, both sides. That means 2.4 milligram by 100 gram. That means 2.4 milligram per kg body weight. You got the calculation? Normally in vitro tested, normally we use micromolar concentration, right? From this micromolar concentration, we convert in the microgram per ml. You got the concentration? Right. Now, either you have to give this dose to mice or rat. This same in the mice, the blood glucose is 1 ml. Okay, 1 ml, then 30 gram, then you have to consider the microgram per kg body weight. Either it is mice, or it is rat, or it is rabbit, it doesn't matter. Okay, you have to calculate with microgram or milligram per kg body weight. What we exactly did it. Sit here. Yes.
This can be applicable for all administration or just for food.
Sorry.
Sir, this calculation can be applicable for all route of administration.
No. So your answer, okay. So after lunch, there is a class for pharmacokinetics and pharmacodynamics. Okay. If you give orally, more. If you give intravenous, less. It is depends on route of administration.
This is just a general.
No, we did those we calculate for orally. It depends. If normally giving orally, it's easy. Okay, so if you have enough compound, if you give it orally. So if you have less compound, okay, if you have less compound, then you have to give intravenous. Or in giving intravenous, you need some expertise. Even if you give them intravenous, this is the bioavailability is 100%. Okay, intravenous is always good, but it depends. It needs highly experienced person. Okay, but the problem is, yes sir, problem is normally this kind of dose we give every day. Okay, but 7 days or 15 days we give it. So if we give intravenous, what happens? You know, we found if we give vein, the vein is injured. 15 days, if we every day if we pick the vein, okay, then the vein will be with some inflammation. Okay, so therefore we try to avoid it. If it is single dose, it's okay. Or if it is 7 days or 15 days, then you will develop some inflammation. So either it is your result is due to your compound or due to the inflammation. It's another confusing. We call confounding factor. Sit here, as I told you, in allergic acid, we found this is the dose. This is the dose, allergic acid. It is insulin secretion. This one control 50, 100, 200, and this is the TB. We found 200 is better. 200 is better. So 200 means 200, as I told you, in 200 microgram in vitro, it is 2.4 milligram per kg body weight, right? Okay, 2.5 milligram per kg body weight. So very simple. If it is make half or double, it doesn't work. It takes at least for working allergic acid, it needs 25 milligram per kg, 50 and 100. And 25 milligram is not effective. 50 is the effective. That means 2.5 and 50, 10 times higher, 10 times or more than 10 times. 50 divided by 2.5, 12, 10 times higher. Okay, there is no straightforward relationship. Because idea, at least you idea. Okay. Another interesting study, the cinnamic acid. Cinnamic acid, we use 10, 25, 15, 100, right? So here, this dose, 2.5 milligram per kg body weight dose, we found here cinnamic acid, 5, 10, this 5, 10, that means just double of the dose or 4 times of the dose, it works. Here, we checked the bioavailability of cinnamic acid. You see, we use 10 milligram per kg body weight. Okay, see the calculation, 10 milligram per kg body weight. That means 10 milligram per kg means at least 4 rats. 10 milligram, 4 rats contain 40 ml blood. That means 1 milligram per 4 ml. That means 250 microgram per ml blood. This is the concentration, right? Then this 250 microgram, we applied, we checked it, see it here, cinnamic acid in 1 hour, 2 hour, and 4 hour. In 1 hour, we found the 33 microgram per ml, and 2 hour, and 4 hour. We got almost 100 microgram per ml. That means we give 250 microgram per ml, and we got up to 4 hours. That means we checked its bioavailability. What is the amount you are giving, and what is the amount in the available in the blood? Okay, if you give something, it is not available in the blood, it is meaningless. Okay, a good drug should have good bioavailability. So some of my another example, okay, we did some many compounds. This is ED compound. So 100, 200 doses. We see in this way, we did in vitro, in vivo, and finally in vivo, same. So what is the micromolar concentration? We convert it microgram per ml, then we give it in the rat. Okay, we get some idea. What are the dose we got it? With this dose, half of the dose, double of the dose, 5 times of the dose. In this way, the result we are showing, we published it, only the positive result. Before positive result, we did many experiments, many doses. Okay, in this way, by in vitro to in vivo, you'll soon get idea. With this idea, with this bioavailability, what kind of component it is. Okay, now computer aided drug discovery, it gives some idea. If you give the compound, its bioavailability, and what kind of drug is, it gives many information. Took all the information. If it is more soluble, more permeable, you need less. If it is more soluble, less permeable, you need more. In this way, you have to think and you have to start. You make some point that this may work. This is another example, coxone. We got it. Okay. And these are some of my publications. So where all those calculations there, as well as in vitro to in vivo data is there, and pharmacokinetics, bioavailability, all kinds of information is here. All are giving my own experience for my research. Okay. So I'll be very happy if you want to experiment, and if you need any help from my side, my group side, we are willing to help you. We are willing to help you. And sir, your question, I told you, a mouse is not a rat, is not human. A specific metabolism response to a species. A nail in the coffin of murine models for critical care research. Model. So model is model. We can put it. Normally we took some model and keep it with showcase. We not use it. Okay. But our reality, we need, okay, in our dream, we can think my model is Shah Rukh Khan, my model is Imran Khan, my model is Mahira Khan, my model is Kareena Kapoor. I need zero figure. Okay, but in our real life, we need हम चाहिए कि मैंगो पीपुल आम आदमी चाहिए. Model छोड़ो. If you need model, then you have to put it showcase. Okay, so model is model. Okay, you can think. Okay, but as I told you, a mouse is not a rat, a rat is not a man, but there is some relationship. There is some interrelationships. Okay, and there is, as I told you, there is no hard and this is the idea. This kind of idea. So if you do any experiment, in the first experiment you got the result, we called it beginner luck. One experiment, beginner luck. You got good results. Without knowing anything, you cook something, very good taste. But but you are learning many things, how to cook, how to carve, this, you cook, it is tasteless. Okay. So I wish a good beginner luck. Okay. If you got result, very good. If you don't got result, then it's called research. SARS and SARS. SARS and SARS. It is research. Do again and again. You'll got it. Yes.
But in Gulbar, did not successful, so we can report it.
So this is the sad part. This is the sad part. Okay? This is the sad part. See here. So I showed my previous lectures. So we developed different models, right? In obese model, non-obese model. Okay. So though I work on pre-diabetes, I am very much interested to develop a pre-diabetes rat model in Pakistan. High fat diet. It is the only solution. So we have to give high fat diet. So I hire one research assistant. Okay, his name is Sanjay. She is very much extremely good in animal experimentation. So we purchase high fat diet is not available in Pakistan. Okay. Then I went to the butcher, Kashai, Chorbi, chicken, cow. I purchase it. And my research assistant, she made the high fat diet. The problem is it's high fat. If you normally food, we have to make it in oven. Temperature is almost 80 degrees. All the fat is melting. We cannot make the food. Then because our animal has food making only one thing, we cannot make the food. Then for all the experiment done, we made the low temperature. We made our own food at own temperature. Okay. Normally, when they make the pellet, make 100 degrees. Normally, we make it 60 degrees. At least we can make it. But that means we found that the animal is not taking the food. The rat is not taking the food. We struggle 1 year. Success is 0. We make it high fat diet. Body weight is healthy. Weight no. Then my student, research assistant, he get idea, sir. So because we're taking that 200 gram. So they are familiar with the normal diet. They're not taking the high fat diet. She got my sir, one thing we can do it. So the rat pups with baby henna, normally after 14 days or 20 or 14 days or 21 days, when they stop the breastfeeding, they will take the food we call weaning time. Small weaning time when they start the semi-solid food first time, we call weaning time. So if you see my publication there, it is written pre-diabetes model development in weaning rat. So when breastfeeding stop, we did not give them normal food. Day 0, they're using high fat diet because they don't have the taste of the normal food. They the day 0 or first day, their taste of high fat diet, and it is the success story. Okay, as I told you, you have to think it. Okay, pre-diabetes model I showed you. So behind the 1 year history, lot of animal, lot of food we made by yourself in different ways. Finally, we success it. Okay, we got good result. You know what I did? I purchased this food from Europe, and it is more expensive. I did it. My challenge, what established a pre-diabetes model. So when I published the result, many people have wished one on pre-diabetes model. Everybody did the same mistake. What I did? They 20 gram, 200 gram rat, they give high fat diet, 0. Then some people came to me, I told, no, this is the only one of success rate is if you give the rat high fat diet on the day, we need time. So if model is not working, okay, therefore, so sometimes you have mobile, right? You have charger. Okay, sometimes in one pin, sometimes 2 head, 3 head. Think if head 1 is not working, second one is 1. Second one is not 1, third one is working. There is option. So if your model is work, well and good. If not work, think in different approaches. In mobile phone charger है, charger USB है ना, USB केबल है ना, one side USB, there is a type A, type B, type C है ना, 3 different है ना. So if your type A work, well and good. If not, type B. If not, type C. There is no guarantee your model will work. If it works, it's well and good. If not, you have to think in different ways. This is the only solution in research. There is no straightforward correlation. Okay, and even make a duplication of a model, it's not easy. The food, okay, the laboratory condition, winter and summer is different. In winter season, we add heater in animal house. Okay, to maintain animal, not easy. 24-hour light and dark circle. You have to maintain it. Always you keep a thermometer there. You keep the humidity, temperature, many things. So many things you have to consider to make that. If animal is happy, remember this thing. One is house, another is housewife. Remember this thing. House is beautiful, but if your housewife is not, then his house will be Jahannam. But if your house is not beautiful, but your housewife is beautiful, then house will be Jannah. So that means house is not important. House is important. Those people, young people want to get married. उसका मामू की कर रहा है, उसका बाड़ी है कि नहीं है, किधर 2 मंजिल के 4 में, वो नहीं देखो. To the point. वो जो एनिमल हाउस का ना, देखो एनिमल हाउस, वो जो एनिमल है वो तुम्हारा हाउस ऑफ है सारा है. प्लीज फोकस ऑन योर एनिमल. So This is the end of from my side. Yes, sir. Yes, sir.
One
Yes.
comment, sir. In hyperfood, we know that the fats of cow fat is used.
High amount of fat is there. High fat diet.
High fat diet.
Yes. Normally in the animal food, there is a carbohydrate, protein, fat, vitamin, mineral, salt. There is a composition is there. ठीक है से? Protein is 15%. What is carbohydrate is this percent, 30%, and fat is say 5 to 10% like this. So how do we make it? Carbohydrate less, protein less, the remaining protein, carbohydrate, and fat. This thing remaining mineral, this weak is constant. How do we do it? We make the amount less carbohydrate, less protein. This less carbohydrate, less protein, we add additional fat.
But just to share one event, one of our colleagues, his wife went on vacation for 1 month.
Okay.
And somehow or other, one rat invaded in the kitchen. And in that almirah, there was a bucket of ghee,
Okay.
the cow fat.
Okay.
And after a month, when they came back, there was a huge rat which couldn't walk and escaped from the way where it is got inside. And eventually they came.
Yes, as I told you. Okay. So in the rat weight 200 gram. Okay. 200 gram. And when we got high fat diet, normally if patla dubla hai na, they can move very fast. Okay? If it is healthy, bulky, they can move fast. No. If you move healthy, your metabolic rate will be less.
Sluggish.
Yes. Okay. So one of my colleague, by seeing the rat, he told me, so it is rat or elephant. In his life, he never ever seen this kind of big yeah. It is normally animal is the rat is straightforward, but normally उसका जो length है ना वो तो same है, but high fat diet length is same, it's wide expanded, it makes some rounder shape. Yes, round shape. Yeah, yes, you're right, and it is cannot move easily. Yes, yes, sir. Anything? Yes.
We were talking about animal models. If I talk about cancer, there are like more than 90% the drugs which pass from preclinical, not preclinical, in vitro labs or in vivo models. But when they go to the clinical trials, more than 90% drugs fail. So it means they are suggesting us we should develop new models. And some people are like working on organoids, 3D bioprinted tissues. I think we can work on them as well.
So this is the sad part of the story. Okay, sad part of the story. So either any disease in the you are working something, you are getting result in mice or rat, this on. This when it goes to the clinical, it is not only for cancer research, almost all disease. Okay, more than 80% drug fails in clinical trials. Okay, more than 80% drug fails. Okay, as I told you, a mouse is not a rat is not a human. So the problem is that in rat, remember very carefully. So you are doing workshop 3 days. You are mentally set up for 3 days. If we make announcement, Dr. Hafiz will take another 3 days class. You will do the class. You will do, but will tomorrow interest. 50% will do, 50% will not do. The 50% you have initially first day tomorrow interest, love, affection down level. You are human. Okay, they are mice or rat. So if they are mice, they are in cage. Okay, they are in cage, same environment, same food. Okay, we are human. So in my workshop, today's we started breakfast, and today's breakfast is different. If you give same breakfast, then you will comstech दिया की दिया एक ही ब्रेकफास्ट 2 दिन दिया हाँ एक ही लंच 2 दफा कल भी बिरयानी था आज भी बिरयानी you got your behavior because they're casing so after 3 hours you are counting time after when during last time first you check the mobile Facebook कितना comment ये थे ना but because your behavior animal behavior is completely different because your human life is more safe and secure in prison, in jail. But you want to go to jail? No one. More safe, more secure. Food is ready. No one enter there. But people don't want to stay there. They want freedom. Okay, this is big difference. So your physiology, pathophysiology, it's kind of in case and outside the case is different. You are not in control environment. Now in AC condition. After sometimes you will non-AC condition. Okay. 25, 37. At home, this one. Here, you are very calm and quiet. At home, you will be very angry with your father, mother, your wife, your husband. So, this is many things. In animal house, we can manage temperature, humidity, same food. But at real life, you are giving the drug, but we cannot control your food. You cannot control your emotion. We cannot control your love and affection. It's impossible. Okay, it's impossible. As I told yesterday, to become a volunteer, very difficult. To get a volunteer. Sometimes for biochemistry study, we hire people for 1 month. You have to stay in the hospital. We'll pay for that. You will stay there. But you cannot, the 30 people or 60 people or 100 people, 60 people or 100 people have 100 types of mindset up. Someone like tea with sugar. Someone like tea without sugar. Someone like tea, sugar and milk. Someone like 2 spoons. Okay. So there's many factors. Okay. There's many factors. Therefore, in environmental condition, in laboratory condition, and the human condition is far difference. It was outside him. Inside, as I told you, digestive system, metabolic rate, many things different. They're in controlled environment. We are in uncontrolled. Okay. Yes. Yes, sir. Can you speak loudly?
Wild and domestic, wild and laboratory animal.
Why? I don't understand. Why? I told you yesterday, you know, an American president, he had a cat. Cat, black and white doesn't matter. Main function he can catch the mice or not. Color doesn't matter. Okay, so you're using white mice in our center, we have black mice. Okay, so normally scale difference. Okay, normally you have color doesn't matter. Color doesn't matter. So the albino mice is white color. The bulbsy mice is the black color. Color doesn't matter. Okay, either it's black, you have black hair or white hair. It doesn't matter. Either you can pass the examination, they matter. Either you have a short hair or long hair, doesn't matter. Most important is you can cook better way. If a long hair, you cannot cook, useless. Okay, so color doesn't matter. Eh? Don't go for color. Eh? Work is more important. Eh? Don't go for color. So can someone help me where is chat box here? I couldn't find it. So if some student asks any question in chat box. Chat box or more. Okay, yes, sir. Any question from online student? ये की बात है भाई? So, thank you very much. Hopefully, after lunch, we'll got the thermocatalysis pharmacodynamics. Thank you very much. Yes, online students, after 1 hour, we'll again came to the lecture series and we'll deal with the pharmacokinetics and pharmacodynamics, inshallah. Thank you very much. Thank you. Hello, hello, hello. Can you hear me?
Yes, sir.
Online participant. Because share.
Yes.
Okay. Yes, my brothers and sisters. So now we'll start on pharmacokinetics and pharmacodynamics. Okay. So during the drug discovery, so you are testing different compound, different chemicals. Hello, can you hear me?
Yes, sir.
So you are getting different chemical or different compound, right? You did test it on test tube. Then you are testing on.
वैसे हम सुन सकते हैं. That's good enough. But the
Hello?
online they will not use.
Hello, 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 hello.
Hello, hello.
Yes, those students, your backside, can you come in front, please? सामने आ जाओ, सामने आ जाओ. Yes, those are online student, can you hear me? Can you hear me? Yes, student, can you hear me? Hmm? Hello, can you hear me? Yes. Okay. One is pharmacokinetics, another is pharmacodynamics. You did your drug tested on test tube, cell line, then animal, then it goes to clinical trial. Okay. Before clinical trial, so you will go and give the drug to the, you take the drug, right? So what happens? Drug is goes to our body. Two things. One, the effect of our body to the drug. Another is the effect of drug to our body. One is pharmacokinetics, one is pharmacodynamics. Pharmacokinetics means in the words tick 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 second cut. That means pharmacokinetics, effect with time. Okay. Effects with time, pharmacokinetics. Or pharmacodynamics means effect with efficacy with time. Pharmacokinetics, remember this word K. So in Urdu, इसे क्या बोलता है? Ear, कान. It is part of body. Okay, sometimes we have to give medicine to ear drop. So if you give the medicine, what the effect our body to the drug? It is pharmacokinetics. And pharmacodynamics, D is there. Okay, D is there. That means drug, D for drug. Effect of drug to our body. Clear? Don't make confusion. It is confusing. Always make confusion, but don't make it confusion. Kinetics. Can. So if you give the drug, what will effect? How our body will affect with the drug? Kinetics. How drug will affect our body will dynamics. What the body does to a drug, it is pharmacokinetics. In pharmacokinetics, okay, normally there is 4 different things. One is absorption, digestion, metabolism, and excretion. So if you take a drug, okay, you're taking drug, right? It will, what happens? It will absorb first. After absorption, it will distribute it throughout the body. Okay, after distribution, so it will do its work. After doing work, you have to eliminate from your body. Elimination. No, sorry, elimination. So the things, either any food, anything you take, either lunch or dinner, the form you take and form you leave is different. So that means the things after distribution, your work is done, then the chemicals or drugs should be a small fraction metabolized, fractionated. And before for excretion, there is some criteria. Okay, it should be soluble. And in this way, it eliminates from our body. Let's say when little by little absorption. Drug absorption, movement of drug from site of administration into plasma. Okay, so either you'll give orally, IV, it goes to the blood. Okay, it goes to the blood. This is absorption. Okay, you can go to route of drug administration, orally, IV, intramuscular, inhalation, transdermal. Okay, sublingual and topical. You can give the drug sometimes in eye drop, nose drop, okay, some inhaler in different ways. Different ways. You see, this is the, as I told you, this is the stomach, this is the intestine, small intestine, this is large duodenum. So you see this one, absorption, okay, here. You're taking a drug, right? Medicine, capsule, okay. It absorb, absorption, how it get in. Then it will be distributed throughout the body, right? Distributed. Then it will become metabolism. It is in liver. Then it's excretion. This is this whole process called ADME. Ad, absorption, distribution, metabolism, and excretion. 4 things is the call. So absorption depends on many things. Okay, rate of dissolution, particle size, physical states, lipid solubility, formulation, pH, ionization, many things. It depends on absorption. So drug has to cross membranes in order to reach to the target sites. So our target tissue or target cells, okay, you know, in cell or tissue, there is a lipid bilayer. Then it is lipid bilayer, then the lipid soluble or water soluble. Then lipid soluble drug will be permeable fast, or water soluble drug will permeable fast. Which one? Lipid soluble. Okay. Passes with the help of transport system, direct penetration, different ways it passes it. One is active transport, passive transport. Okay, sit here little by little. So okay, there is active transport and sometimes it's passive transport. Okay, passive means if it comes automatically. If automatically comes, so it higher concentration to lower concentration, it comes automatically. Okay, you see, sometimes in river side, so sometimes in somewhere in the upside. Okay, so if there is a barrier, so upside there is a lot of water, in downside less water. Then if you make the open the gate, it automatically come downside. But if you take water from downside to upside, then what will you do? Energy. You have to like motor. You need a motor, pump. Okay, energy needed. Same is true. So see, sodium in our body, in blood, blood is extracellular or intercellular? Blood is intercellular or extracellular? Extracellular. It is not in cell, outside the cell. Okay, blood is extracellular. Okay, so in blood, our sodium concentration is so high. In my first session, I told you 0.9% sodium chloride, right? So people give 0.9% sodium chloride intravenous. That means in vein there is blood. So 150 millimolar. So that means the sodium concentration in our blood, the same concentration we are giving by injection. So in blood, the sodium concentration is roughly 150. Got?
Yes.
At 140 to 150. But inside the cell, the concentration is only 4 to 5. That means outside is higher, cell is lower. If from blood to cell goes sodium, it passive. And if from cell to blood, active transport. So if it make it reverse, this is potassium. Potassium in blood less, cell high. Okay, see it here. So higher concentration to lower concentration, passive transport, and What higher is high. So for passive transport, for active transport, energy is required. For passive transport, energy is bilkul wrong. Okay, you need energy. Okay, if you ride in mountain with some vehicles, चलने के लिए it need fuels. When you come down, you need fuels, but less fuel is needed. If you ride in mountain, your energy is needed. Okay, for passive transport, energy is needed. This is active transport. Some drug needs active transport. Some is the passive transport. Sometimes some molecule cannot transport by himself or herself. Itself. He needs something's carrier protein. For example, you want to go to meet some ministers, right? So you unable to go there. Then you have to check someone who is uska PS or uska PA, right? Or you need someone who can mediate it. So somehow we communicate. Leader, neta hai na, uska chamcha hai na. Somehow you have to go enter. You cannot enter. You go there, then so there is a barrier to enter the room. So if the PS or PA or some personal log hai na, with him you can go inside easily. Okay, then you can do your work, and after work is done, you can come back or exit from somewhere. Same is true here. Some molecules, it needs some carrier protein. It here, work done, and it exits the same way. Active transport, passive transport, vascular transport, and sometimes some molecules, it is a small molecule. If it's a small molecule, it penetrates easily without any help. Now, you got the clear idea regarding the molecules, how it goes inside. Now, come to the point, absorption kinetics. Okay, see, once you took medicine in your body, before taking medicine, what is the concentration of medicine, or what is the concentration of drug in your body? 0. Once you take it, little by little bit, increasing the concentration, right? After sometimes. So once when you enter this workshop, your concentration is 0. Little by little, you are in the peak, right? So after 5 days or 7 days, all the things will be down. After 1 month, 2 months, 3 months, 0. How to remember it? So best way, we have there is a curve we call forgotten curve. Okay, people forget everything. Almost everything. So how to prevent it? The best way, take notes. After class, you have to study by yourself 1 hour, at least make your own way, some notes. So then you are working with how people are developed. Okay, it's the off time and on time. Okay, you are giving the lecture, you send some notes, okay. Off time means you are eating. Okay, off time means you are in the walking, running, taking showers, cooking, these times. So this time just recall. So pharmacokinetics, these. It stuck somewhere. Check your notebook. Okay, in this way, just like music, okay, a song. If you listen to music or a song many times, you can remember. Okay, same is true. People forget everything. Okay, so how not only these lectures, so how to remember for at least 2 years, 4 years lifetime. Follow the forgotten type. 30 minutes, read 30 minutes, some breaks, and memorize this one. Not memorize, visualization. Make it clear, imaging. This. In this way, you can anyway. That concentration peak. If anything is peak, there is a. Okay, this is the. Here plasma concentration, here plasma initially plasma concentration drug is 0, right? then it goes increasing, its peak. This is a maximum concentration, maximum peak. Then down, 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 down. Okay, if you see the peak here, this peak here, we called it Cmax, concentration maximum. The point here, a time, we called it Tmax. This time, maximum concentration. If it is Cmax, if it is the zero, it is 0, it is 100, right? If you divide in between, half, 50%, half Cmax. If half Cmax, if it line it draw hit here, see half. Clear? Good. Here, sit here, this is the Cmax, this is the Tmax. Okay, and here, this is the half T, this is the half Cmax, this is the T half. So that means this peak here, this is the time of absorption. Why it is decreasing? Due to elimination. So then how you can, okay, come to the point later. Therefore, due to elimination, therefore in medicine you have to take multiple doses. Once it is down, you have to take another doses. Down, up, down, up. Then you can make a label. Okay, this is Cmax, this is the Tmax. Okay, one thing here, the seat here, it is starting time, and this is the 0. Okay, here we called it absorption lag time. So this curve initially I showed you here now. This is the theoretical, it starts from here, but reality it starts little bit later. We call it lag time because you are taking the blood, taking the drug now. It goes to the blood, not now. It will take some time. So taking the blood and goes to the blood. The time here we call lag time. Yes, my brother and sister, see it here. So here in this way, in this way, in this way, in this way, in this, right? So this is Cmax. This is Cmax. So in Cmax, some point, this is the Cmax, some point down and some point up. We called it therapeutic window. And lower the line, lower the therapeutic window, we call it subtherapeutic window, or above the line is the toxic window. Yes. So here you pass in intermediate, right? Intermediate, yeah, GPA is in GPA system or percentage system here? Percentage. That means if someone got 60% mark, he got first division, right? First division. This 60% mark first division, and what is the second division? 40%. And what about the third division? 33%. Say if you consider, if you got 60%, 60% got, okay, 60%, if you got the 60% mark, that means 60, uska half hai 30, right? 60 plus 30, 90, 60 minus 30 equal to 30. Then 30 to 90, this is your range. Okay, if you got more than 90, some confusion is there. If you got less than 30, fail. That means if you got more than 90, your papers will be checked, rechecked, and many times. Okay, that is okay. So that means don't take it otherwise. So same is drug. In drug works somewhere, uska above range. This is working range. As you told, you are getting exam on 100 marks, but 30 to 60, it's enough. Okay, 100 जरूरत नहीं है. ठीक है? So it is too much. ठीक है? Same is true. One is window, above toxic window, below. Okay, this is the story. Many people, as I told you. Okay, so health is happiness. Health is your hand, not in doctor hands. So if you take medicine, there is a dose, 8 hours or 12 hours, every 12 hours. People do what they do. People are too smart. People carry their mobile phone everywhere, but they don't carry medicine. Carrying medicine is more important. And don't believe that you'll come back, you'll go somewhere, you'll come back and take the medicine. Don't trust in it. There is many times, road will be blocked. Many effects. Always carry medicine. When we outside, if you take medicine, my honest suggestion, okay, health, either it is in sublethal condition, sub-window, it will be very dangerous. At certain stage, your body will be resistant with this drug. Okay, so my suggestion is to you, please use practice, change yourself first, right? Change yourself first, change your family, and then change your society. Be healthy. Doctor can only give prescription. You have to purchase your medicine, you have to take medicine in time. Otherwise, if you fall into subtherapeutic window, then we'll complain, medicine come nahi kar raha. Sit here, normally, so we are taking medicine, it goes gut, liver, vein, heart, lung, heart, and artery. This is the classical pathway, okay? You sit here, if it goes in this way, this is the line, this is the maximum, this is the concentration of blood, concentration of drug in blood, okay? If you give in the vein, so vein, if you give vein, it goes directly to the blood. That means the concentration is increasing in here. The peak is take less time. So if you give in the inhaler, it goes directly. So if this kind of lung inhaler, so this is the blood, this is the concentration of drug. In case of orally, this is in case of intravenous, this is inhaler. So depending on the route of administration, it takes what's life-saving drugs. Sometimes it's very dangerous. People give immediate effect. Okay, see here on 3 graph, one is orally, this one orally. Okay, this is the concentration of drug. It time. This one is the intramuscular, and red one is the intravenous. If you go intravenous, it goes directly to the blood. Minimum time. Okay. You got at least basic idea regarding pharmacokinetics and no, only pharmacokinetics. Okay. So that means you're taking blood, taking drugs, depending on the condition of route of administration, it goes to your blood, right? So once it goes to blood, then what will happen? Say initially drug concentration in your body, before taking blood, the concentration of drug in your body is 0. So after taking blood, concentration of increases, right? So increases. So now think. So okay, now in plasma or blood, the concentration is 100%. And in cell, what is the percentage? Now your drug is in blood. Okay. Say whatever the concentration, forget it. Say it is 100%. Say it 100%. Now what is the concentration of drug in cell? 0%. Clear? All the drug, it is in now blood. Now blood is the extracellular. It is outside the cell. That means in the blood 100%, in cell 0%. That's enough. Then little by little, from blood to cell, blood 100%, cell 0%, 90%, 10%, 50%, 50%, 60%, 40%, 100%, 0%. Got idea? This is the distribution. If after giving a drug, after if you see the you collect the blood, okay, you see 100 milligram per ml. You collect blood after 1 hour, you measure it is 80 milligram per ml or drug A. And drug B, you similar drug, after 1 hour, you will get 20 milligram per ml. Drug A, drug B. Whose drug has more distribution pattern? B. If drug in plasma or blood, drug in blood, no distribution. Less amount of drug available in the blood, it is distributed. If you have money, 1,000 rupees, I tell him, okay, please distribute it. After 1 hour come back, I found out of 1,000 rupees, 700 rupees is there. That means you already distributed 300 rupees. After 1 hour, out of 1,000 rupees, only 200 rupees. That means you distributed 800 rupees. If you pocket more money, that means less distribution. If you pocket less money, more distribution. Same is true in blood. More drug, less distribution, less drug, more distribution. Clear?
Yes, sir.
Here is some calculation. Total body water is normally our body water is 60%, right? 60%. In this 60%, intercellular 40% or extracellular 20%. This extracellular, okay, this extracellular part into two part. One is plasma, another is interstitial fluid. Cell and blood. In between the part we call interstitial fluid. Okay. So in distribution, there is two kind of distribution. You are giving drug, okay, it goes some tissues, okay, kidneys, liver, then it distributed whole, okay, whole of your body, total body. What we call it before administration, central compartment. First it goes to central compartment and it goes to the total body. Okay, one compartment model, and another is one compartment model, another is two compartment model. You give drug, it distributed everywhere, and then it distributed first. If you give something to the 10 peoples, you can give donation distribution, or you can give someone will give 10 peoples. Okay, via someone. Same is true in some organs, then it goes to the body. This is the distribution. So in drug, blood, then so site of action. Action is the different cell. The drug should be put in the cell. So distribution transform drugs between compartment and another extracellular fluid and tissues. So here is the drug, here is the intercellular. This is the intercellular, this is the blood, extracellular. In between, we call it extracellular fluid or interstitial fluid, right? See it here, good example. Left side, see carefully. Okay, so this is cell, this is cell, this is blood. Okay, this is blood, this is cell, and in between this part we call. So if total body is, okay, so 60% total body male, sit here, 60% is fluid. Out of 60%, 2/3 is the intercellular. A cell, intercellular. 2/3. 1/3 is the extracellular. Out of 1/3, 70% is the, this is the, this ratio is big. This is only blood. Okay. And 20% is the plasma. So even drug distribution, initially well-purpose organs sometimes go to liver, heart, kidney, brain, then everywhere, or sometimes directly everywhere. It called distribution is predominantly a passive process. It goes in blood, it is 100%. In cell, it is 0%. Higher to lower, passive. Energy needed or not needed? Needed. Yes. Okay, distribution of a drug is not uniform. This is the key message. Okay, so if you have 1,000 rupees, you have 100 rupees, 50 rupees note, right? So normally it is, you cannot give everywhere the same money. Depending on the situation, depending on your relation, you have to give different gifts to different people, right? Okay, same is true in our body. Some tissue is hyperactive, hyper is moderately active. Okay, so depending on the tissue distribution, so distribution pattern is not uniform. Different tissue receive the drug from plasma at different rates and to different extent. Okay, so distribution also depends on many factors. Now there is drug factors, pH and media, regional blood flow, where more blood flow it goes, distribution is more quick. Okay, and pH of the media. So in our body, what is the pH of our blood body? 7.4. But not everywhere. Not everywhere. Sometimes we have acidic pH. Sometimes we have some organs. So bile acid, gallbladder, the pH is low. So that means if it is in lower pH, if a drug has lower pH, it will absorb in lower pH area more quick. Okay. Drug factors. Lipid soluble, water soluble. If lipid soluble drugs can cross easily to cell. Cell is the lipid bilayer. Okay, lipid bilayer. If it is what lipid soluble, it goes
easily.
faster. It is water soluble, it is slower. If it is lipid and water soluble, then moderate. Low is good, low, moderate, and high. Which one is good? Moderate is good. Okay. Molecular weight. So if a molecule has bigger molecular weight, distribution is time consuming. A small molecular weight, faster. So, and there is another factor, we call it drug binding protein. Okay, drug binding. So your drug is here, we call it free drug, right? Free drug goes anywhere, everywhere. So some proteins help, okay, to binding of drug. So albumin on the albumin protein, drug binding protein. What is the beauty? What is the beauty of the drug binding protein? So drug binding protein, it gives some restriction. Okay, your blood has 100% concentration. Cell has 0% concentration. Okay, so the free blood, it will be finished soon. If we make some binding, some restriction, okay, cell are using 10, the 90 in my blood, right? So after using the 10, then again 10 will be given to him, given to the tissue. In this way, it makes some reserve. Okay, sit here. This is the blood. Okay, this is the cell, intercellular, and this is the extracellular. This is the drug, this is the drug, this is the drug. That means this 1, 2, 3. Okay, and this is the free drug, and 1, 2, these 3 drugs, it bound with some binding proteins. Okay, only the binding proteins, only the binding drugs can pass the, it is an intercellular fluid. Okay, sit here, this binding protein came here, right? Then only this free protein can enter in the cell, can enter into the cell. So the binding protein help as a reservoir. So it goes little by little, little by little, little by little, little by little. In this way, you need less dose or less frequent. This is the advantage of the binding protein. See it here, free drugs. Okay, free drugs and reserve drugs. Binding protein make them as a reservoir. Okay, here 1, 2, 3. Then one release. Okay, then one by one, one by one, one by one. In this way, drug distribution. The volume of distribution. The volume of distribution, also known as apparent volume of distribution, it is used to quantify the distribution of drug between plasma and the rest of the body after oral or parenteral dosing. See it here. Okay. So volume of distribution, if we calculate the mathematically, dose of the drug given and concentration of drug in plasma. So if we give 100, okay, 100 milligram and plasma concentration is 1 milligram, okay, that means volume of distribution is 100. It depends, okay, depends. Then, so you take the drug, it absorbs in blood, then it goes to where? In cell, right? Cell is the site, action site of the drug, cell or tissue. Okay, the drug will go there, bind there, do their work. Okay, do their work. So if something wrong at your home, you will call some carpenter or plumber or someone, right? So if you consider your home is a cell, you ask someone, plumber, this one, you sit here, you'll go washroom, fix the commode, fix the the things, then you'll pay your job done, then bye-bye. He or she have to leave. Even sometimes in your house, if some guest came, 1 day it's okay, 2 days is okay, 3 days will be okay. And 4th day you will be feeling disturbed. Your guest, foreigners, it's foreigner at his home. It should be eliminated as soon as possible after doing his work. Same is true in the cell. Work done, and it should be removed. Okay. The problem is, okay, once the problem is the after work done, you have to the elimination or removal is not easy. Not easy. Then, so as I told, okay, told means in the high fat diet, which is chua, rat, it's more healthy. That if door is small, then what will do? Door, the option 1, make wider the door. Option 2, which is rat ko, make it small pieces. So drugs works now. Anything go from your body to outside. Most of the drug is created from in our kidney, our urination system. During urination system, the drug must be soluble in water. The drug either it is soluble in water or it is soluble in lipid. But during elimination, it must be in water soluble. Okay. Therefore, metabolism, we call it sometimes metabolism, sometimes we call bio transformation, one form to another form, so that it become main thing of the metabolism is the make it insoluble to soluble. Okay, there is many ways routes of drug administration. Then what happens? Okay, metabolism. So metabolism happens where? Liver. In liver, there is liver cell. What is the name of the cell? Liver hepatocytes. In cell, there is some organelles, Golgi bodies, ribosome, endothelial reticulum, right? One is endothelial reticulum, we call it smooth, another is rough. In rough, protein synthesis happens. In smooth, drug metabolism happens. Okay. So, metabolism, another thing is, remember the thing, we call it fast pass metabolism. Okay, this is any important thing. So, you are purchasing, you purchase one box of mithai, sweets. One box contain, say, 10 sweets, right? You are giving to someone, please give to someone. Okay, so you're giving someone, so he taste one. Okay? Taste one. Then he gives to right person. Then how many sweets remaining? 9. It is acceptable. But वो जो टेस्ट कर रहा है ना अच्छा लग रहा है, दूसरा और अच्छा लग रहा है, थर्ड वन एक और है, ठीक है ना? Either he took 5 or 6, between 50%, he gives 50% to the right person. That means 50% loss. So, same is true. The metabolism, the drugs, we are taking this one, it goes to liver. Then it goes there, again it comes to liver. So, if it takes only little amount of, it metabolizes little amount of drug, available. No, some metabolism, liver is part of metabolism. Okay, it goes liver, then this again come to liver. Okay, but if the first phases, the metabolism is in liver very small. Okay, it's okay, but if it is too much, we call it fast pass metabolism. Got it? So if a drug has more fast metabolism, then what is the solution? There is 2 solutions. Option 1, you can increase the dose. Option 2, change the route of administration. See it here, this is the drug, right? This is the drug, comes here, okay, comes here, then here, then here, then goes here, hepatic portal vein, okay, this one, then it come here, right? If it goes, if maximum of the drug you are getting here, maximum of the drug you got it here, it has less fast metabolism. If it less amount here, that means if the drug has more in fast metabolism. The drug has fast metabolism is no good. Either you have to increase the dose or change the route of administration. Another is bioavailability. If you give the blood blood amount, what is the available in the bioavailability? If it is maximum, those drug has more bioavailability, this is more good. Okay, the main thing of drug metabolism is convert lipid soluble and non-polar molecules in water soluble. This is the only option. Okay. Then how we do it? Drug metabolism site, it is in liver. Other side is kidney, intestine. This is the minor side. Okay. Okay. Active molecules, inactive molecules. Okay. Types. Phase one. Okay. So this transformation of normally in metabolism, there is two types of transformation. One is we call it type 1 reaction, another is type 2 reaction. In type 1 reaction, there is some modification, some oxidation, OH group attachment. In this way, it makes insoluble to soluble. And type 2 is some group attachments of ethylation, methylation, acetylation, this kind of called phase 2 synthetic conjugation. Okay, the oxidation, reduction, this one the type 1 reaction. And phase 2 is the acetylation, methylation, some addition of group. So in this way, it makes metabolism, and metabolism makes some soluble form. And if it is soluble form, so it makes normally soluble form a phase 1, then phase 2, then OS product. Okay. So one protein is P54. This is responsible for this here. You see it here. This is drug. One OS group here. Initially it is A's. It is OS. Then it is many OS, but with more polar, right? Then it is easy to excretion to the kidney. And okay, this is many. And another is, see it here. This is aspirin. Okay, this is OS. Okay, this is more OS. Then easy to excrete. In this way, metabolism and excretion. So see it here, excretion, some drug easily excrete, right? Someone phase 1, it can excrete. Then some drugs, phase 1, it convert to phase 2, then out. Some drugs 2 directly. Someone 2, then 1, then excretion. Initial, okay. Break, phase 1, excretion. Phase 1, phase 2, excretion. Phase 2, excretion. Phase 2, phase 1, excretion. Then elimination. Elimination done mostly but done in kidney. In kidney. So see it here, drug excretion. Okay, drug excretion mostly on kidneys, but some things, some from liver, some is feces, some is saliva, some skin, some milk, and lungs. You are breathing in this way. Sometimes some breastfeeding with excretion route. Sometimes we have some sweating in this way, different ways. Mostly in urine. So in these different ways, if it is water soluble, it goes through kidney. If it is in different ways, it is impossible to make it water soluble. It goes to elevate through feces, stool. Okay, the main thing of the kidney cell, we call it nephron. Nephron works as a filter. So how many kidney people have? 2. Are you sure? Okay, but very interesting. In some part of the world, it is very unique. Some people have 3 kidney.
One of my relatives had 4, and all of them were working.
Mashallah.
She died at the age of 52.
Okay. So if someone has 3 or 4, it gives another story. That means initially kidney transplantation, right? You have to remove one kidney and replace by one kidney. So this 3 kidney, it gives a new dimension of treatment. So if no need trust also, so what happens? 1 kidney, 2 kidneys there, keep it as it is. They added another kidney. CP, okay, excretion. So if it is, so if you concentration of blood, concentration of drug in your plasma, and concentration of your drug in your urine, right? If it is high, more concentration is plasma, then elimination is less. More concentration is urine, elimination is more. Very simple. So in elimination, there is two types of reaction it follows. We call it first order elimination, one is zero order elimination. So zero order means it doesn't depend on concentration. Okay, you are getting say 100 milligram, 100 milligram and 100 milligram, and elimination rate is 10 milligram per minute. Okay, that means in 1 minute 10 milligram gone. Second minute another 10 minutes. Within 10 minutes 100 milligram finished. We will call it zero order. Okay, but in case of first order, it depends on concentration. So in 100 milligram, 10 milligram per minute. So first 1 minute, 10 gone. What is the remaining? 90. Then in second minute, what will be gone? 10%?
Oh, 90.
90?
9.
9. So initially in the zero order, in second minute, 10, in first order, in second minute, 9. If 9 goes, remaining is 81. And third minute, 10% of 81, 8.1. That means you have more money. Okay, if you have more money, no. So if you have less money at the end, so then you have to be careful, right? So if you don't careful, then you have to take some money from someone. So normally what we do, when you get the money, initial of the month, we're very happy mood, any food. But at the end of the month, we're very safe, secure, and conservative. It is good. Okay, it is good. So the first order elimination is good. But if it is eliminate everything very quickly, then you need more drug. The first order elimination is good. Okay, see it here. This is the this is the, we call it toxic side, and this is the dosing. So this is the therapeutic range. Why we need multiple dosing? So this is the first dose and second dose, right? So it is increasing, decreasing. Then third dose, fourth dose, fifth dose, sixth dose. That means you see there is making a range or windows. That means if you take multiple dose, take in time. To make it easier, this is the story of pharmacokinetics, right? Yes, sir. Yes. Make it, global PDF. So you got it here right there regarding pharmacokinetics. Yes. So we have here more. Okay. If you is over. Yes.
25 minutes.
25 minutes. In here, last something. Now, if you make the research, if you don't have how to make the so you can go to see from the of the other example and so at least you can go to point.
Yes, we will be very much happy if you can share this slide with us on WhatsApp.
So one is pharmacokinetics, another is the pharmacodynamics. Okay, as I told you, what drug to your body. Once you came the drug came, absorb, distribute, and distribute, and it actually start on tissue or cell, right? We'll see what happens. Okay. Pharmacokinetics study how our bodies effect. Okay, sit here. See, the pharmacokinetics. What happens with time? With time, concentration, right? With and pharmacodynamics, it's with concentration. What is the effect? Concentration versus time, it is the pharmacokinetics. Concentration versus effect, it is the pharmacodynamics. You see it here. This is ligand, means it is drug, and it is the cell. It binds somewhere. Okay, then it comes enter into the cell. This is the drug. Once it binds to the receptor, the shape of the receptor is changed, induced. In many ways, it goes to the inside. So sometimes in the receptor, the drug act as a agonist. Agonist means friends. If you are here along with your friends, you're more comfort, more easy to go anywhere. But sometimes the drugs is called what as a antagonist, enemy. So you cannot enter it. So drugs either work as agonist or work as a antagonist. So if it is agonist, if something is there, so some molecule is binding is here, it is only one receptor. Normally in the cell, thousands and thousand receptors. In thousand receptors, thousand natural molecule, then no drug is binding. Thousand receptors, 500 natural molecule binding, and 500 in the your drug bind, then production is more. Same is true in antagonist, it reduce the production. If 1000 receptor, 1000 natural molecule, production going on. In 1000 receptors, 500 natural things and 500 antagonist, the production is 50%. If more antagonists bind, production is less. Okay, that means if it is inhibit 100% strong inhibition, 20% we call it mild inhibition, mild antagonist, severe antagonist, right? So this is the ligand, this is the receptor, we call it ligand receptor complex. Okay, so one term is either this drug is effective or not, we call it sometimes efficacy, one term is the potency, either it is effective or not. Okay, one is efficacy and effective, potency it is either how strength of a drug particular doses. Two things. Potency, remember this thing, this one, so one dose response. So this is 0%, this is the 100%. Okay, so one is blue line, another is red line. Whose drug has more efficacy, more effective, red or blue? Blue. Anyone? Blue and red, both are same efficacy, both are 100%. If two students give examination, right? So someone finish exam 3 hours, someone finish exam in 2 hours. Okay, so if they got same mark, time doesn't matter. Both are got same mark. Someone get 2 hours, someone get 3 hours. Both are efficacy is the same. But who finished the exam in 2 hours, it is more efficient, more potent. Efficiency both are same. इसका potency ज़्यादा है. So they are here, both are nil, blue and red, both have the same efficacy. Both are 100%. But blue one, it gives 100% in less time. That means blue one is the more potent. Here, here, same drug A, drug B. They both have same efficacy, but this one high potency, this one low potency. Clear? So this is okay. Yellow and red. Which drug has more efficacy? Yellow and red. Sorry, yellow and green. Yellow has more efficacy. And right side, yellow and green. Whose drug has more efficacy? Both are same efficacy. Whose drug has more potency? Yellow. Here, yellow. Maximum effect. Both drugs have same maximum effect, but different potency. A, B, C, D. Okay. All the drug has same efficacy. A has more potency. A has maximum potency. D has clear. So potency, efficacy in this way, y-axis, and efficacy in y-axis, potency in the x-axis. More close to x-axis, more potent. Efficacy, look, it's high, it is low. Okay. High, low, okay. A, B, C, D. A has more highest efficacy, D has lowest efficacy. And what about the potency? What about the potency? Here, the graph 1, it has low potency. No, the graph 1 has low efficacy, high potency. And graph B, high efficacy, low potency. Which drug is good? Just read the summary of the, okay. One drug has low potency, okay, right side, B. It has high efficacy or low potency. Okay. B. Potency doesn't matter. Efficacy. So you are finished exam 1 hour, 2 hour, 3 hour doesn't matter. So means so if you get 100 mark, it is the matter. If you good mark, it is the matter. You finish it in time or half of the time, it is not important. Important is maximum mark. Okay. High efficacy is better than the potency. Okay, sit here in green line. This is the green line. Okay, sorry. Green line, this is the normal graph. Okay, green line. So in green line here, so it is the normal graph, and red line is the toxic effect. Toxic effect. You see in green line, where is the maximum effect is done? The toxic effect start. Here, so it is no effect. Here, see, this is no effect. Okay, one is no effect, another is the toxic effect. In between, no effect, toxic effect. In between, we call it therapeutic effect. Okay, and we call it therapeutic window. Therapeutic window, right? Therapeutic window. So if a drug has larger therapeutic window, it is less toxic. If it is narrow therapeutic window, more toxic. See here, this one, and this one. Okay, this is the therapeutic window is wide, more safe. Right side, therapeutic window is narrow. It's no good. Okay, the narrower window, then more dangerous. Sometimes in our normal drug, it's more wide range, but the cancer drug, immunotherapy drug, their therapeutic window is very narrow. When the efficacy start in the same dose, toxicity start. Okay, therefore many side effects. So this is the end of the story. It is here. So X, Y, A, B, C, D, many graph, right? In many graph, that means this is C and this is D. C and D. Whose drug has more efficacy? Both are same. Whose drug has more potency? C. Then A and B. Whose drug has more efficacy? Both are same. Whose drug has more potency? A. Okay. Now my question is A, B, C, D, right? Now my question is, if you consider C and A, whose drug has more efficacy? Whose drug has more potency? Against C. Okay, so even it is any drug, both if the the two drugs have more efficacy is different, but potency is the same. Whose drug is good? Efficacy. Efficacy is more important to the potency. Okay. So some drugs are more efficacious, some drug has more potency. So during the work done, efficacy is more important than potency. Yes, sir. Can you ask him? The last actually last one. $63, 62. So I already finished everything, but for a few information, I give somewhat the normally drug either acts as a agonist or antagonist. I'm giving the real life some example. You'll get and look at. Okay, just a few minutes. Oh no. Okay. Okay, it's a drug. Okay. Here, drug, receptor, bind it here. Okay, then different ways. Okay, here you see it. One is agonist, another is antagonist, another is partial agonist, it is inverse agonist. Okay, I'm giving some examples. See it here. Okay, so this is water, right? This is water. Okay, if you see it here, water tap here, there is something is there. If you press it, water will come easily and 100% efficiency. It is called fully agonist, right? Here you see it. Okay, if a father is here, full speed. If son is sitting here, the flow of water is partial. It's called partial agonist. Okay, so if a caterpillar sit here, no, either father or son, no one will sit there. It is antagonist. Okay, then to remove antagonist, what will you do? What will you do? This is agonist, partial agonist. If antagonist is there, then चौकीदार के बुलाओ. So वो जो है ना उधर सेंसर है, because this water will come only your family, not for चौकीदार. He can sit here, remove the antagonist. Okay, so once it is free from, then it is, we call it, sorry, inverse agonist. Okay, so this is the some example. Okay, some example. So this is agonist, right? It is, so your work is going on. If it is full agonist, then efficacy is more. 1 time, 2 times, 3 times, 4 times, 100-fold increasing. Okay, if it is partial, 10-fold. Okay, so if it is antagonist, what happened? If it is antagonist, the basic activity will be there. If it is antagonist, the basic activity there. But it is inverse agonist, then activity will be down. Activity will be down. So our drug works sometimes agonist, sometimes antagonist, sometimes partial agonist, depending on the needs of your body. Okay, depending if you need it, first complete inhibition, strong inhibitor is needed. Okay, sometimes depending on your body needed. So dose, if you go to the doctor, okay, doctor give prescription dose normally. Sometimes dose vary. Sometimes someone give low dose, sometimes one get higher dose. Sometimes frequency, sometimes 1 tablet per day, sometimes 1 plus 1 plus 1, 2 plus 2 frequency. Everything depends on the year. So this kind of work is done in the animal. Initially, before going to the human, okay, this kind of activity is done in animal. In animal, we did pharmacokinetics, and pharmacokinetics, we get some idea. What about the drug we are giving? We collect blood, 0 hour, 1 hour, 2 hour, 3 hour, 4 hours, after maybe after 24 hours. I just check blood, the drug we given, all the drugs in the blood or not. Okay, then we check, if we calculate how much drug we give and how much drug it is in the blood. Then we check, okay, in this check we pharmacokinetics. Then we also check, we collect 24-hour urines, 24-hour feces from the rat or mice. Okay, we have a metabolic case. The rat can stay metabolic case 24 hours, and 24 hours, all the things will come down. We measure what is the amount of drug in urine and feces. In this way, we can calculate what is the amount we given, what is the amount drug during this time in the blood, and what is the amount of blood during excretion. In this way, we got some idea. Okay, with this some idea. If you got any drug, it is good, active good, but it is not eliminated. Very dangerous. Okay, somehow it should be eliminated. Otherwise, if it stay inside your body long time, it may cause harmful effect. Number one. Number two, drug-drug interaction. Something is there. If you have a new drug, in drug-drug interaction, many complications happens. So any drugs, before all the test. So students, my dear friends, so if you purchase any medicine, there is a box. In box, there is a kit inside. Written there. All the pharmacokinetics, all the pharmacodynamics, it is written. So if it is stay more time in the blood, elimination rate is less, then you take 1 tablet per 24 hours. If it is eliminated too fast, a faster metabolism, you have to take more doses more frequently. In this way, those are calculated. The key point is, take home message is, so one is therapeutic window, another is a toxic window. In therapeutic window, what is the range? What is the range? What is window? Drug is active and effective. We call effective dose. Up, down, up, down, up, down. In this way, it maintains a good range. So, my dear friends, so health is happiness. Doctor can give medicine. Doctor cannot give you health. You have to take care of yourself. Take good medicine, take medicine in time. As I told you, drug metabolism, it should be water soluble. Take water, take water, take water. Okay, during medicine, take sufficient water so that your drug should be eliminated smoothly. If it is more water, it is diluted easily, can eliminate it. If you don't take water, it is highly concentrated. It will be extra pressure to the kidney. Okay, if it is pressure from kidney, a big loss. Big loss. Okay, so at least either you can able or not able to drug discovery. At least you can able to take right medicine, right time. At least you can save your kidney. Please save your kidney. Save your kidney of your family. This is the end of my talk. So if you have question, query, I am available here. Yes, please. Yes, yes. Yes, yes.
Sir, while designing the research methodology, sometimes we use research methodology based on dose-dependent therapy in therapeutics, dose-dependent manner, and sometimes we do it in time-dependent manner. Which one is the better?
No, dose dependent is more important. Dose are that somehow, as I told you, it depends. So either dose is either first thing is that you need efficacy. Time is not important. Dose is important. Dose is important. Okay, dose is important. Thank you. Thank you very much, sir. See you tomorrow, inshallah.